recently you saw in the US that a gunman tried to shoot a presidential nominee and was actually brought down, but despite that, and even missed, but despite that, the head of Secret Service resigned their post. Now in Kenya, during your tenure as CS, over 100 Kenyans have been killed, murdered by the police. You know that maybe over 1,000 people have been injured, and property worth billions of shillings has been destroyed. Not to forget that a lot of Kenyans have also been abducted, and as we are talking, there are still people, families that are still looking for their loved ones. Now, we did see that the Inspector General of Police resigned. Do you think that as a CS, you should not also have taken responsibility, political responsibility for that failure that the resignation confirms, and also either resigned or declined the appointment? It's also important to note that during these demos that were held, a lot of people were shot, and there is clamor and request and for justice. In fact, I've attended, one of them was a constituent, Erickson Mutisia, and we've gone to those funerals, and the families are asking for justice. You have forensic evidence because you have the bullets, and you know that every bullet that comes from a gun can be traced. Why have we not seen arrests and arraignment in court of the police officers that are accused or that were involved in these shootings? Because that would appease the public a little bit. Allow me, Mr. Speaker, to also point out that the CS has had, the nominee has had a very illustrious career. And, PhD, you've done consultancy all over. And when you are here for the approval hearings in 2022, after all those many years of working, your wealth was at 544 million. Now, 2 years later, your wealth now is at 694 million. That is a whopping 150 million shillings more. Maybe you could explain to us, is this increase probably related to the office that you hold? It would be important for us to know. And finally, Mr. Speaker,
too many questions, Robert.
Mr. Speaker, just one last one, because we are doing very well with time, Mr. Speaker. Just one last one, yes. Which is because I'm just picking out some of the things that some of the members have said, yes, on the matters of insecurity and criminal gangs, Mr. Speaker, that have been out there mugging our people. There's burglaries, in the North Rift. There are all these issues of cattle rustling and all that, which you have admitted there are issues. Now, my question is, when you know that we have such insecurity in the country, what was the logic behind making a decision to send 1,000 police officers to go and secure Haiti when Kenya has a problem? Thank you, Mr. Speaker.
Professor.
Mr. Speaker, those are 3 questions. The first one, the Honorable Boy asked, the example the member gave about US, where the candidate for presidency was nearly killed, raises a number of issues. One, he says the person who attempted that was killed. That demonstrates use of force, even in our local context, is allowed, because nobody raised issues with that criminal who was wanted to kill Donald Trump. He was shot dead without questions. Number 2, the honorable member has said that the director of the Secret Service resigned, but also drew a parallel and said our IG also resigned. The minister did not resign in the US. I don't know why the Kenyan minister must resign. And nobody asked the minister to resign, because ministers don't instruct operations, they instruct policy. I can only resign if my policy instruction is unconstitutional or illegal. Then on the question of those unfortunate incidents when Kenyans lost their lives and the quest for justice, I strongly believe that there must be justice, and every death that occurred must be accounted for. However, Mr. Speaker, the process of putting together criminal investigations, including forensic evidence, is not something that can be rushed. It takes a bit of time all over the world, not just in Kenya. I believe IPOA should help the country to get closure, and I have promised, if I am reappointed, I'll encourage the collaboration and support and goodwill between IPOA and the police in terms of providing information so that justice is served. I have also been asked about my wealth, which has increased from 544 million to 694 million. It is true because, first, let me start by saying that I have not benefited from any improper business. I have not done any business with government. Let's start from there. I have not applied for any tender by myself, by proxy, by relative, or by anybody. Mr. Speaker, before I was appointed, my wealth was at 544 million. I said at that time, which I still do now, that I have run a business, which today I do not participate in that business. I don't. The life and working, and much of that revenue has actually come through the revenue from my law firm, which is still active but being managed by other people. I think all my salary and allowances have been spent in paying bills. Therefore, most of the increment in my net worth is because of three things. One, the legal fees, some of which was actually pending by the time I was being appointed, and I said it here, that there are some unpaid legal fees, which some of them were paid. In fact, I remember 2 months after I was appointed, one of the clients paid a significant amount of legal fees, which had been pending. Other than that, I do small businesses and so forth and so on. None of my money has come from the public except the salary and the allowances that I'm entitled to. Lastly, on Haiti, it is true that the government of Kenya, through the National Security Council, decided to deploy our officers in Haiti pursuant to a request by the UN Security Council and the UN General Assembly. These are international obligations. It has not affected our operations, and it is not true to say that since there are problems in Kenya, we cannot also do our international obligations, because all countries in the world do have security issues. They have security matters. Even the country you consider safest has its own security matters. And therefore, it is a great honor for our officers to serve in Haiti. So far, they are doing a good job. I believe they will profile Kenya properly. They will bring honor to our country. And that deployment has not affected our operational capabilities. I submit.
Thank you, Speaker. Thank you.
Don't be like your neighbor. Ask one question.
I'll ask only one question, Mr. Speaker. Professor Kithure Kindiki, in your first stint as CS Interior, you are associated with strong statements, such as "we will crush you," you'll be met with the full force of the law, "we will deal with you firmly and deadly," and many other words like that. Statements which seem to fuel police extrajudicial action. And Kenyans have taken notice of such statements, that probably they fuel police extrajudicial action, and the use of excessive force, because if you tell people we'll crush you, the police will crush you, that's what it will entail. As you see now, there's a new awakening in this country about what public officers are saying. How different will you be if we approve you? Secondly, you are also the civilian face among the police and the security organs that we have. But as you took up this job, probably, Professor Kindiki, you became more of them, more of a police officer, not a civilian within. You are donning police uniform, you are all over police choppers, and you behaved like a police officer, which probably took you away from the police direction that you're supposed to give the forces, and became more of an operational leader instead of a policy director in the force. How will you be different on this? And probably lastly, you are more in the sky than on earth. When you want to give policy direction, you want to give guiding, you need to be in office, have meetings, boardrooms, and give policy direction. But you have said you actually went to Lamu 21 days, 21 times in 21 months. And probably in the operation field more than where you are required to give operational or to give policy guidance and direction. And that's why the police force and the administration, national government administration, is not properly coordinated. How different will you be as when we approve you as CS? I thank you.
Professor?
Mr. Speaker, thank you. I've been asked to say whether I'll change my language. Mr. Speaker, I need to clarify that it is true I have used very, very unique language. But, Mr. Speaker, this is security language. And the people I address when I use those terminologies are not the law-abiding citizens of Kenya. The people I address with that difficult terminology or unique terminology are terrorists, bandits, organized criminals. Those are the people I tell will crush you, and I mean it. Last time I appeared before here, the member for Samburu West asked me what I will do in Kurkur and other places when criminals descend into gorges, and I'll say I'll flatten the gorges. We've done a bit of that. There were places in Baringo, Corcoran Hills, a place called Tandare, a place called Ngelecha, and in Samburu, the Malaso Valley and other places where criminals would always retreat and have a field day, operate from there. We've neutralized them and removed them from there. So, again, the use of force is permitted by law, depending on who that force is used against and in what circumstances. And the escalation methods are used. You start by asking them to surrender. If they don't, you use other methods until, if they challenge you or they want to kill police officers, the police officers will kill them before they kill the officer. That is the law. Mr. Speaker, on the second issue, I have been there at headquarters driving policy in boardrooms, Arambe House. I've had so many meetings in our campuses in Kiganjo, in Embakasi, Roiro, Police Leadership Academy. But I've also been in the field more. Why? To disseminate policy to our forward operating bases, to our camps, to our officers in the field, in the counties. And even in the counties, before I even start my meetings, I would sit with the county security committee in a boardroom, disseminate the policy, because they are the ones who will be left to implement. And I have also been in the most dangerous spots in our territory with our officers in the front line. Why? To give them moral support, that we have not posted them there to die. We have posted them there to protect the country, and there is no greater morale booster than for the security minister to go and visit the officers, have lunch with them, encourage them, and tell them what the government policy is and what the government thinks about them. So it has been very rewarding. I will be back in the normal manner, but I will of course balance between my headquarters work and also the field work. Lastly, I've been asked to land. I have always landed. For every flight, I have landed. And finally, on the issue of uniform, what I wear is tactical attire, because there are some things which protective clothing that you need tactical wear to be able to have protective clothing and protective facilities, because you're in a dangerous situation. I don't wear that on the streets of Nairobi. And also I have been in not just police helicopters but military helicopters, because the law provides that the security minister be facilitated when he is in dangerous situations. The Minister for Interior, the Minister for Defense must be facilitated, because the nature of our work is we are exposed to risk and danger by virtue of office. Otherwise, I do not fancy it's only that it's all in a day's job.
Morugara. Thank you very much, Mr. Speaker. On a CS nominee, let me take you away from the police officers, the bandits, and all these other insecurity matters you're dealing with, back to national government administration. I recollect very well that when you were here, we actually questioned you on it lastly during the vetting, and emphasized that the nerve center of the national government administration is in the villages. That we do have very serious workers in the villages who possibly are not recognized by the national government, but who play a key role in the service and security provision and everything else, so that we can avert incidents like the Shakahola and the quarry incidents we've talked about. Here I'm talking about the village elders and the Nyumba Kumi workers, whom you use extensively 24 hours every day, every month and every year, and in a form of service which is very similar to servitude or some form of modern day slavery. These people are not remunerated. Your response that time was that a policy was going to be put in place immediately, and that they would actually start getting a form of remuneration. The question I have to you is, how far has that gone, and when should these people expect their paycheck? Whether check, whether M-Pesa, whether whatever is going to be, when should they expect to be paid?
Mr. Speaker, sir, we have finalized the Village Elders Bill 2024. It is one of the 12 pieces of legislation that are awaiting cabinet approval for transmission to Parliament, and therefore that matter will be sorted out in the shortest time possible. I submit.
Waziri, I want you to again go back to Haiti, where we actually deployed almost 600 police officers. My fear now is that with what is happening around there, the fact one of my voters at home has one of his son actually deployed, and the question is, how secure? Do you have special security insurance for this particular, just in case something has happened? Of course, that has led to a deficit of police officers. That's why when you had demonstration here, you had to get in the army, because we don't have enough police officers, so because some of them are away. Secondly, I also have had a case in North Rift. In fact, my colleague is just walking in the North Rift, where you have this police reservists have been disarmed, and yet we have problem in North Rift, and those are my borders, and we have that problem, and yet you have actually disarmed the police reservists. What are you doing about that?
Professor will take Daud, not the questions.
Thank you, Mr. Speaker. The CS nominee, you have promised regarding passports a couple of times, and you know passports are the most important. You initially said within a day, within a week, within 2 weeks, but apparently the passport issue has not been sorted out. The other issue is regarding the IDs. Your department has rolled out that IDs will be 10 years, whereas we have known all along IDs did not have an expiry date. What informed the decision for that one? Because now we've got Maisha number, which has been already declared unconstitutional. But what was the point of launching Maisha number when we had a Huduma number which did not work? So now
region which have strengthened their infection prevention and control programs. So I supported in matters of development of their strategic, their national action plans, and also in developing guidelines, facility assessment, monitoring and evaluation framework, among others. Equally, I supported in emergency response, in emergency preparedness, readiness, and response pillar.
That will do. I will now invite the Deputy Speaker to be the first to ask your question. When questions are asked, to expect precise and concise answers. Deputy Speaker.
Okay. Dr. Barasa, as you're aware, the health financing strategy of 2020 to 2030 notes that Kenya's health financing is inadequate, incomplete, and inconsistent, and poses a challenge to the establishment of a universal health coverage. And now, with the shift from NHIF to SHIF, the effectiveness of the transition is being debated by Kenyans. So, what are the primary gaps and challenges that you perceive in the implementation, and what should you do to address them if confirmed as Minister of Health?
Dr. Barasa, can you answer that?
Thank you, Honorable Deputy Speaker, for the question. For the primary gaps and challenges, my approach is a consultative approach. I believe that it is critical that we bring all stakeholders together. The Director General, as well, the PSS, the National Technical Working Group, stakeholders, as well as other sectors, including Treasury. We also need to involve the community. It is imperative that the community is informed and that they are aware and they own the SHI. Without the community owning it, implementation will be difficult. And so we need to strengthen communication, receive feedback, and analyze. In the consultative process, we need to conduct a situational analysis to see the strengths, the weaknesses, opportunities, and threats for the implementation of the SHI, and come up with priority actions to intervene and support in a seamless way. So, as I said earlier, community ownership is critical. Equally, we need to strengthen the operations and the logistics. If we don't have enough financing for the SHI, then the implementation will not be seamless. Equally, we need to address the logistics challenges that may arise during that. One of the challenges that I have seen Kenyans talking about is the Linda Mama. And before coming even before you, honorable members, it was raised to me. And I believe that it is critical that we have a transition plan or a transition guideline to ensure that our mothers and our children can access care even during the transition process.
Thank you. Majority Leader.
Thank you, Honorable Speaker. CS nominee Deborah, I see you have a very good experience from your professional background and having worked in the private sector in healthcare. And one of the issues that probably might have come to your attention is the ills that bedeviled the defunct NHIF. And the move by government, and I'm certain you may have taken keen interest on the Social Health Insurance Fund and the challenges that are there now with the Social Health Insurance Fund. One of the problems that we've had with the NHIF is collusion between staff at NHIF and private medical care providers, unfortunately including faith-based ones. And we have seen exposés in the media of very small private hospitals raking in millions, hundreds of millions from NHIF. I would want to hear what, having looked at SHIF, which I'm certain you must have looked into, what are the measures you intend to put in place should you be approved? One, to curb the theft that has been witnessed in NHIF by both the public and private medical practitioners, especially owners of private hospitals. Two, how do you intend to leverage on technology to ensure, one, that you bring down the cost of healthcare in this country? There are hospitals that will charge NHIF 200 shillings for paracetamol. There are others within the same vicinity that will charge the same fund 30 to 50 shillings. How do you intend to utilize technology to curb some of those things?
You may proceed to answer.
Thank you, Honorable Member, for raising the concerns, and indeed, I understand and have interacted with various Kenyans that have raised the very same concern. First of all, my approach is a consultative approach involving the multiple stakeholders, from the PSS, Director General, the National Technical Working Groups, the NHIF, among others, including the community who are receiving the services. And with this, we need to conduct a situational analysis to understand the challenges, and from there, come up with interventions and action plans. But from an outside view and working in various organizations, I have seen the strength of having processes and procedures, of which I believe the government has, and we need to strengthen this. One of the ways is using a digital platform that will reduce the human-to-human interaction and will be able to monitor challenges. And this needs to be implemented first on a phased approach, but ultimately at a national level. And that way, we'll be able to monitor various services that have been given. We'll be able to monitor the quality. We'll also monitor the prices, the stockouts, etc. So I believe it's critical that we embrace the digital platform as Kenyans. Again, transparency and accountability frameworks are critical. So we need to look into this, and I believe that the National Technical Working Group is really competent, having interacted with them in the WHO environment, and I think we can work together with the multi-sectoral approach to ensure that we have transparency and accountability, open tenders, among others. We may also consider using external bodies to monitor and ensure that we have no challenges in that. And leveraging on technologies, I believe it's time that Kenyans embrace telemedicine and also embrace the digital platform as discussed earlier.
Junet?
Thank you, Chairman. Chairman, my question to Dr. Deborah is, Madam Nominee, as you are aware, health is majorly a devolved function. Health matters happen at the county level. But the problem this country has encountered for the last 10 years or so, since the new constitution and that devolved health functions, is because there is no seamless working system between the national government and the county government. It is devolved, but you'll see a lot of things are happening at the national level. All the complaints are at the national level. And these things are supposed to be at the devolved, because the dispensary at the village there is what matters. So how do you intend to make sure that health is really devolved and resources are taken to devolved units so that people can get the services at the road there, I mean at the village there? And my last question is, you can see health, the number of medical students also are increasing, and the number is becoming big. There are more health workers that are being trained, even as doctors. But the institutions that are training them now are becoming deplorable, in a very bad state. Do you think that will compromise the quality of healthcare or the quality of services Kenyans get? Thank you very much.
You may proceed to answer.
Through you, Honorable Chair, I would like to respond to the Honorable Member regarding the health, the devolved government. So again, a consultative approach. I believe we need to involve the national team as well as the county government to have open dialogue and come up with interventions. We need to look at the situational analysis and see where are the strengths, the weaknesses, opportunities, and threats. And from there, we need to come up with priority interventions. So I'm coming out of the government, but I believe having open dialogue, having consultations, and coming up to ensure we understand where the national team stops and where does the county begin. Another thing that will ensure seamless flow of information and also to ensure monitoring from national level down to facility level is the health information system, a digital platform, so that the reporting system is picked up and goes to the national level and also trickles down to the facility, as well as tracking and monitoring of infectious diseases, quality of services, and also addressing the matters of corruption. So again, it will be critical for us to embrace the digital platform in this case. Regarding the medical students, what I would say is the health workforce is a critical pillar in health systems. All our health workers are important. The doctors, the nurses, lab technicians, physiotherapists, nutritionists, among other cadres. And let's not forget the morticians and the cleaners who are frequently forgotten. And I think it's critical to say that during COVID-19, we saw that these cadres were actually disproportionately affected by COVID-19 and even other infections like tuberculosis and Ebola. And so we need to strengthen our health workforce. With the numbers increasing, I believe, again, it's a consultative effort. We need to bring unions on board. We need to bring professionals on board, the doctors on board, and come up with strategies and areas of improvement. We also need to strengthen our regulatory system to ensure that we are bringing out doctors and other health workers or professions who are qualified, because we are also thinking of these doctors or nurses and other professions working outside Kenya. So we need to ensure that we are providing quality, top-notch quality and highly experienced health workers that are able or capable to work in the in other international spaces.
Thank you, Chairman. Dr. Deborah, my question is that the instances where doctors have been going on strike have risen, with the recent one being the interns in July 2024. And we know what that means, especially to the Kenyan populace. I'd just like to know how, moving forward, you'd like to resolve this issue, looking at the root causes so that it doesn't recur. And also we have the community health promoters, where they're also saying that there's stipend delays, it is low. How do we just ensure that people who work in the health sector, because it's a very important sector, are taken care of in terms of their remuneration and also their welfare? The last question to you is that whether you understand the magnitude of the ministry that you will be leading. You have very critical departments and areas. We have KEMSA, you have the malaria control, you have the AIDS Council, you have the ministry itself, you have a chief, you have all that. How will you ensure, or what leadership skills will you use to ensure that the policies that you put in place, you implement, cascades to all those departments, and not, you know, because we see in health department and also some of the big departments in this country where a CS just wakes up one morning and start issuing different directives, right, left, and center. I would like to know what leadership skills you will use to ensure that does not happen.
Go ahead and answer.
Through you, Honorable Chair, and thank you, Honorable Member, for the questions. So indeed, the doctors' strike has been a challenge over time in immemorial, and every cabinet secretary has dealt with that challenge. And so there is need to look for long-term solutions. I believe that the long-term solutions are with us. So we need to work together with the unions, the doctors themselves, the interns. We need to work with the bodies, the Ministry of Education, among other stakeholders, to come up with a solution. I don't have a solution, but what I am saying is we need to have a situational analysis and be able to develop action plans following that. There is a Doctors' Interns Act that I believe is ongoing, and I think that is one of the areas we can start with and strengthen. Equally, there are the return to work formulas that were given to the doctors, of which we can implement with support from Treasury and other sectors. Regarding the multiple departments, I would want to run the office with high integrity. I have seen that we have wonderful national technical leads in the office. We have DG, we have the PSS. I believe by having weekly meetings and sharing reports, conducting monitoring and evaluation routinely, we can be able to strengthen this. But we need to align it with the national strategy and the MTP plan, identify the priority activities, the timeline, and the budget. And if the Treasury is able to provide the budget, then we can implement. And also based on outbreaks that are at hand. As you are aware, there is a monkeypox outbreak, and also we need to ensure that we are prepared and ready to respond to such outbreaks.
Nelson.
Thank you, Honorable Speaker. Daktari, universal healthcare was a key pillar of Kenya Kwanza manifesto. Given the recent High Court suspension of the Social Health Insurance Act 2023 and the Digital Act 2023 due to what they call insufficient public participation, what will be your strategy to ensure that the public is adequately informed and engaged in key decisions that pertain to their health welfare? How will you then increase public awareness about the benefits and procedures of National Insurance Scheme to encourage greater participation and understanding amongst Kenyans?
Through you, Honorable Chair. Thank you, Honorable Member, for the question. Indeed, I'm a believer of accessible, affordable, quality of care to all Kenyans, including the orphaned, the vulnerable, the needy in our community, the widows, among others. So I believe that we need to embrace a universal health coverage. Right from the community level, with the community health promoters, I have worked in the Eastlands, and I have seen the critical role they play in terms of bringing health back to the community. I have seen the importance of the primary care level. There is an article we published in WHO. I was part of the team that looked, and we realized that the primary care networks are weak and they need to be strengthened, because that is the primary or the first patient, and equally the other levels of care. And so the challenge is that Kenyans have highlighted the 2.75% taxation, and they have not embraced the universal health coverage. They have not seen its importance in terms of accessible, affordable, quality of care for all, including the vulnerable, the disabled, the widows, among others. And I believe that it is critical for us to ensure that we have robust communication with the community. I think it is important that they own this initiative and they are part of it even during implementation. That way, the uptake will be great and we will see many Kenyans achieving this. And from our side, I think it's critical that once we have promised our fellow Kenyans, we need to deliver and ensure that every Kenyan has access to affordable quality care.
Posing.
Thank you, Speaker. Thank you, Speaker. Dr. Barasa, having been nominated for this position, you know that health is generally or greatly devolved. And there have been a clamor or a debate outside there that we should have a national commission for doctors or practitioners, health practitioners, and so on, and for good reason. And one of the reasons is to balance health practitioners at the county level, because that is where the biggest problem is, Madam Dr. Barasa. Because of lack of balance of medical or specialized medical people, you find that actually some of these hospitals are running like maybe, I would say, Panadol hospitals. All county hospitals actually run like Panadol hospitals. Because Panadol is just something small to make you at least live till tomorrow. Take an example of North Rift. Turkana County, West Pokot County, Elgeyo Marakwet County, Trans Nzoia County, even Bungoma County. Almost everybody is going to Eldoret for medical services. Why? Because they don't find those services. Maybe because of lack of specialized practitioners. So my two questions. One, will you support the clamor for the constitutional amendment to have this commission to be able to work out on that balancing of medical practitioners so that our people can get medical services at the right places at the county level? Or if that's a long term, what will you do if Parliament approves you, you're working together with governors to be able to increase or help that health specialist at the county level so that at least we can have our people at local level receiving medical services? Thank you, Speaker.
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, with the devolution, we've seen a lot of challenges. My approach, again, would be a consultative approach involving the counties, involving the National Technical Working Group, the DG, the PS, and all the stakeholders involved, including partners. And in this case, we need to have these consultations in routine basis to discuss the HR capacity. Additionally, we need to come with strategies, action plans, including regulations to ensure that all the counties have the appropriate specialists. And we can monitor the presence and the activities of the specialists using a digital platform, of which I strongly advocate for. I can also say that I am a member of the Eastern Central Southern African College of Physicians. And in this program, I was the initial group of trainers that was trained in Entebbe, and this program was rolled out in Kenya. And we are almost having the first lot graduating, and they're 41 in number. Additionally, there are other specialist training going on for gynecology and obstetrics, as well as surgery. And these are areas that we can engage with the programs and see how to support the various counties so that they can have specialists trained within the facility.
Vicaria.
Thank you, Chair. Sorry. Daktari Deborah. Nitauliza kwa Kiswahili. Kama budget kubwa sana ya Ministry ya Health inaenda kwa mambo ya matibabu. Magonjwa yametendeka, tunaenda kutibu na mambo mengine. Kukaja na policy ya kuweka the CHVs, the Community Health Volunteers, ambaye wao watashughulika sana na kujaribu kuzuia kabla pengine, na unajua hawalipwi kwa wakati unaofaa, na zile hela pia wanazopatiwa ni hela kidogo sana. Pengine njia gani utatumika kuona kama wataweza kupata hela zao kwa wakati unaofaa na pengine kuongeza juu kidogo, ndio waweze kusaidia kwa kuzuia kabla haijafika ile ya kutumia hela nyingi ya kwenda ku. Pili, watu wengi wanapata ajali, emergency na mambo mengine, magonjwa ambayo pengine hayaku, ama kama ni accidents za barabara. Wanapoenda katika mahospitali yetu, nisiseme ya counties kwa sababu pengine kwa sababu hiyo iko devolved, lakini katika hospitali za serikali wanakatazwa kuwa admitted ama kuchukuliwa katika ile emergency ya dharura ya haraka kwa sababu hawana pesa za kulipa deposit na mambo mengine. Pengine ni njia gani utachukua kuweza kufanya hali hii isiwe ni kitu cha kurudiwa vile tunavyoona kila wakati? Asante.
Answer.
Through you, Honorable Chair, I would like to answer the question by the Honorable Member. Indeed, the community health program is critical because it brings health back to the community. And community health workers are a strong pillar in health system strengthening. And so we need to embrace them and support them. Working in Fikiria Jamii, which is which are 17 clinics in the eastern Eastleigh region, the eastern side of Nairobi. It covered Shauri Moyo, Huruma, Mathare, Kariobangi, part of Korogosho up to Kayole. We were able to strengthen the community health program. And what we did is ensure that they were bringing mothers for antenatal care, bringing children for immunization, distributing disinfectants, providing preventive promotion care and rehabilitation, because they were part of the community. And the work was marvelous, and I'm happy that the country is embracing the community health program. And so we need to support them, and again, a consultative effort involving the multiple stakeholders so that as a team we can come up with action plans and interventions. Equally, we need to involve other sectors like the Treasury and see if we can have funds to allocate for their support. Additionally, partners are critical as well as the CSOs, so we need to involve partners to collaborate and synergize our efforts in order for us to have the fruitful implementation of community health programs and universal health coverage in general. For the emergencies, again, even as we transition, we need to ensure that they are covered, and we need, even in the UHC program, part of what is covered is emergency conditions. And so I believe that by incorporating this, all Kenyans will be able to access care even in emergent situations.
Honorable Robert Mbui.
Yeah, thank you, Mr. Speaker. Nominee, corruption cases have been a major problem in the health sector. Some time back, there were those clinics that were bought, containers that were being charged at about 10 million a piece, which was highly exorbitant. And recently also you've seen when we had COVID, there were scandals at KEMSA, and there was even a recent scandal under this regime which led to the dismissal of the PS then of health. What will you do to minimize, or if possible, completely eradicate this menace of corruption in that health sector?
Through you, Chair, I would like to address the issue of corruption by Honorable Member. Again, a consultative effort. It is important that we think strategically involve the various stakeholders involved, the National Technical Working Group, the PSs and DGs, to understand, to conduct a situational analysis and see where the gaps are. But from my opinion, I think that we need to strengthen the processes and procedures that exist. And one of the ways is through a digital platform. That way, we reduce the human-to-human interface. We can be able to track, say, for instance, how a Panadol from batch 001 gets from the national up to the patient's hand. Yeah, and so we'll be able to ensure that there is a seamless flow. So I am an advocate for the digital platform. Equally, we can involve external bodies to monitor also the challenges that are involved therein, and we can have routine meetings and feedback. Additionally, we need to have accountability and visibility frameworks, and also work together with the various commissions to address the issue of corruption.
Thank you very much, Mr. Speaker. Mr. Speaker, to the nominee so far, Deborah. My name is Owen Bayer. I'm not the honorable member. I hear you talk about situational analysis. I hear you talk, I've counted them, there are 10 now. Digital platform, there are 8 consultations, there are around 7 there. You keep on using the same ones all the time. But the health sector is a big thing, big, very big. And I think it carries one of the biggest budgets in this country. And it has been a Tower of Babel. Okay, there are a lot of conflicting people striking, court cases, a lot of issues. It requires a very high level of leadership. And that high level of leadership is policy. But as I listen to you, I'm not hearing you enunciate or really bring out policy issues apart from consultation. I think the health sector suffers from real strong policies that can drive the sector, so that we have all these issues, these strikes and everything else really not in place. There's been the question that has been asked on, would you support a health service commission, which everybody else has been talking about. Probably that's the panacea for the problems that we have in health. So Deborah, Dr. Deborah, my question is, what skills do you bring? Are you able to work with people much easier? There has been a lot of, the PS is saying this, the minister is saying this, the DG is saying this, the CECs in the counties are saying something else, the governors, the Council of Governors is saying something else. How will you amalgamate all these things and bring real leadership in the health sector so that we do not have the problems that have devolved the health sector over the years? I thank you, Honorable Speaker.
Go ahead.
Through you, Honorable Chair, I would like to address the question by the Honorable Member, Mr. Owen. Yes, from a leadership and a management perspective, it's always consultative. It's not a one-man show. The people, the National Technical Working Group, have been there for many years. They understand the situation, they understand the gaps, and they're able to come up with interventions. The thing that we need is to support them, to identify the gaps and come up with improvement plan. And so for me, I believe that it's critical that I give the leadership and bringing the people together to collaborate, to synergize, to harmonize, to improve the services that are being given.
Thank you very much, Mr. Speaker. Dr. Deborah, 2 very quick ones. Ministry of Health is one of the most important ministries in the country. It's for the rich and the very poor, it's for everybody. And what is bedeviling people living in the villages is we have small dispensaries which have no drugs because county governments are not able to stock them. And Kenyans are crying over whether really we should have this under county governments or we should actually revert the entire ministry to the national government. If a law ever came to revert the ministry to the national government. Would you, if approved as the CS for health, support it? Number one. Number two, again from the same scenario, everybody goes to a hospital. As soon as God helps you recover, you have no money to settle your bill, and even through Arambes, you have all these problems, and eventually hospitals, including public hospitals, start detaining patients. And the converse of that, sometimes you may die, and the hospital detains the dead body. What policy would you put in place to ensure there is a balance, that you cannot be detained in hospital forever when you've recovered, or you can't have your body if you're there? Your relatives cannot have your body detained forever. At one point, there must be a stop to that. What sort of a policy would you put in place?
And answer?
Through you, Honorable Chair, I would like to address the question by the Honorable Member. Yes, so currently we have a devolved government, but we need to ensure that the supplies and we are monitoring and ensuring that the supplies and services are ongoing in the last mile. And that's why I'm encouraging the digital platform. I have seen it work. I have seen it work in Fikiria Jamii. I've seen it work in Mata Hospital. I have seen it work in the World Health Organization. I have seen us track medicines coming into the port and distributing it across Africa. We can monitor. We can also ensure quality. We can monitor and ensure that the health workers are in the facilities and they are conducting activities as needed. So a digital platform is the way to go. There are many challenges that we face. There are many teething problems that will come. But when we have that, then even the counties can sit in the offices and be rest assured, looking at the quality, tracking on the medications, what is out of stock, etc. So a digital platform is critical. And again, about moving from county to national level, a consultative approach. We need to be strategic, yeah? It's not one man making decision or one woman in this case. I believe that we need to involve the county governments, we need to involve the national team and come up with the best interventions to address this.
Deborah, before you go to the next question, please do hand over your documents to the clerk's team so that they can do verification while we are going on. The Honorable Ferdinand. Oh, you have one more question? The retention of dead bodies and recovered patients until money is paid to various hospitals. What will you do? That's what the Honorable Member has asked.
Yes. So strategically thinking, we need to consult and see what are the gaps, what is causing this, and then involve Treasury.
It's money.
Yeah. So I'm coming out of government. So my first agenda will be to review these cases with the national technical team and the county government to identify what is causing or contributing to this challenge. And from there, I believe we'll be able to get interventions.
Ferdinand.
I think it's more or less the same thing, but all I'm saying, Madam, if we are going to be appointed as a CS in health, I think reducing the health care, let's be serious about it. As my colleague I just mentioned, it's very, very serious, a crucial item as we members of parliament. Even now as I'm sitting here, there are phones coming from my constituency. Please, we have got Harambe, yeah? But then of course you as a PS, you're coming in, should be able to have very strategic plans. so that the expensive treatments like cancer, which is again coming up every time, should be able to come up with something very, very strategic for us to reduce the cost of treatment and, of course, affordable access to health care. Come up with something that can be able to save these members of parliament in having a rampage every other day, because somebody is going to India. Instead of us, somebody come here, had 2-3 cases where somebody went to India and he died there. So, and everybody now comes to me, how do you get the body here? But more so, this so-called cancer drugs, which is actually is an issue in this country. So come up with a plan. So I see your experience is very wide. So let's hope that you're going to have that kind of plans to be able to assist us in this. Can you say something?
Statement, Dawood.
Thank you.
Let's take into account the positive statement made by the Honorable Ferdinand.
Thank you, Mr. Chairman. To Dr. Deborah, first, NHIF, will you change the system, or whichever it comes, that a patient can only go to one hospital, nominated hospital, and if somebody gets sick anywhere in the country or anywhere, they cannot go to any other hospital but just one? Secondly, I don't know if you answered the same question by my colleague. Would you consider that all health workers be moved to a health service commission, just like the TSC? And thirdly, the National Assembly passed my bill of cancer prevention in April. And with that bill, it talks about getting more oncologists trained, and because we've got 40,000 people dying of cancer, it's even higher than even COVID. COVID did not kill as many people as cancer does every year. And what do you think you would have interventions to train more people and have more cancer treatment centers in the country? And the last one is level 4 and level 5s. I'm not talking about dispensaries. Would you think that level 4 and level 5s should come back, like the referral Kenyatta Hospital, to the national government? Because 70% of the funds in the health ministry are held by your ministry, if you are confirmed. So do you think level 4 and level 5 should be taken over by the national government from the counties? Thank you.
3 questions. 1, he says, will level 4, 5s be transferred from the counties to the national government? The second one, about the cancer treatment. And the third one was, will you support, if confirmed, to create the National Health Service Commission? I think there is some doctor somewhere who is sending this message to all of us. I've received it 3 times.
And there's a 4th one, Chairman.
Yes.
The 4th one was regarding NHIF.
Yes.
In one hospital, will she change the policy that it should not just be one hospital nominated? They can go anywhere, so long as they've got NHIF. They do not have to go to one hospital.
Actually, that is part of the law you passed recently that is being challenged in court, isn't it? Go ahead and answer.
Through you, Chair, thank you, Honorable Member, for the questions.
Yes, Nelson?
The purpose of this, if you just told me, is actually so that you can address the members by their names.
Yes.
And this is the committee on appointments, just for your information.
Yes. So don't just say Honorable Member. That one is called Honorable Dawood. Okay,
My humble apologies for that.
Yes.
I will address them by the names.
Go ahead.
Thank you, Honorable Dawood, for the wonderful questions. First of all, I would like to talk about local production of medicines and consumables. I think that Kenya, we need to embrace this. Local production of medicines, the health products, is really one way to reduce the costs of medication. And so it's an area that we need to embrace as Kenyans, and based on the budget, then we can consider strengthening this. In addition, regarding the NHIF, the universal health care looks at offering accessible care, affordable care, and quality of care to all Kenyans, including the vulnerable and those with disability, among others. And so the issue of only being able to be seen in one hospital is not part of the universal health coverage. And hence, I believe that once we have implemented the UHC, first of all, the community health promoters will be able to improve the prevention, promotion, rehabilitative interventions within the community. So even for cancer cases, they'll be educated on preventive measures, and those who are having terminal illnesses, rehabilitation will be ongoing. Equally, strengthening the primary care networks is critical because it's the first contact and it filters the mild cases, ensuring that the severe cases are the only ones going to the other levels of care. And hence, there's reduction in the overwhelming of other levels of care. And so I believe that we can have this as accessible, affordable, quality care by strengthening our community health promoters or the community health programs, as well as that we are offering quality care across all levels of care. So regarding the specializations such as in oncology, as discussed earlier, we have the East Central Southern African College of Physicians, which is a program that is running in multiple hospitals within the country, supporting doctors to specialize. We may also consider having this for other specialists, including the nurses, and see how to see how they can grow career-wise as the health workforce, and that way we can also have access to care. For the doctors at the national team, I believe it will be a consultative approach. I cannot make that decision myself. I believe that it's critical that I involve the whole team, the stakeholders, the partners, and other sectors to be able to see how to address this issue.
Point of order, Speaker. Which issue? And I thought if it is about the commission, health, what is your opinion, nominee minister? If you say consultative, what is your opinion as the leader? You support, you don't support, even before you do consultation. What is your input? What is your mind? Yeah, yes. you are running away from being personal.
Yes.
We want to get your suitability, you, not a group, but you. Thank you, Speaker.
Go ahead.
So
the question is, if you are confirmed,
yes,
will you support the creation of the National Health Service Commission? There is some doctor somewhere sending this to all of us.
As part,
ask you.
Thank you, Honorable Chair, and thank you, Honorable Members. As part of the doctors' fraternity, I support the National Health Service Commission. Thank you.
Go ahead, Mary. Eh?
The one for level 4, 5 to move. I'll help you to ask.
The level 4 and 5, Honorable Dawood, I believe that is critical.
To be fair to the interviewee, even as minister, she has no capacity in law to lift level 4 and 5 from the counties to the national government. it must be a legislation and an agreement between the two levels of government to transfer. So even her opinion here will be relevant. Mary Mase.
Thank you, Chairman. Dr. Deborah, I put it to you that for you to be able to realize your policy objectives, you must have adequate or sufficient financing. But when you look at the Ministry of Health, and especially health research, it remains significantly underfunded. And when you look at the budget of the ministry, there is notable dependency on donor funding, especially on research, disease control and management when it comes to control of malaria, HIV, AIDS, name them. My question to you, from your experience in the health space, what are the barriers to achieving optimal funding in health research? Secondly, there are a number of hospitals, if you are approved by Parliament, there are a number of hospitals across the country that have been built through World Bank funding, GOK, and have remained unoperationalized for a number of years. Beautiful structures. Case in point is in my constituency, Amukura. Beautiful structure. They have not been operationalized, no furniture, nothing. So if you are successful, please do an audit of all such hospitals across the country, ensure they have been operationalized so that there's value for money, and before you start building others or advise for others to be put up. I think that the last one, just a comment. Thank you.
Thank you, Honorable Mary, for the wonderful question. I have done a lot of facility assessment, right from the community-based organizations, various facilities at the different levels of care, and also at supporting various countries within the Eastern Southern Africa, as well as the Afro 47 member states supported by WHO. And I'm an advocate for facility assessment. We need to have good capacity, offer quality of care for our patients. And so that will be a top priority for me, to ensure that routine assessment is conducted, that our hospitals are offering quality services. Again, a digital platform would be good to ensure that we are also monitoring and looking at the processes. Yes. So regarding research, indeed, we need to have policies to support research and regulatory. We need to have a regulatory body to look into this. We need to work with the ethics board, among other boards, to ensure that this is aligned. And we have multiple partners who are willing to support in matters research. And so it will be open dialogue, consultation and discussion, and see who can join us to support in the agenda of health research, this being another activity that I wish to undertake.
Thank you, Mr. Speaker. Mr. Speaker, first and foremost, I wish to state that the nominee comes from my county, and especially Saboti. But that will not conflict my assessment of her capacity to serve in that ministry. And I am comfortable from where I sit of her competence, but what I'm worried is that the ministries, especially the Ministry of Health, is a theater of politics. And, you know, the previous minister also hailed from my Saboti constituency. I don't want a brain drain of my sisters coming to Nairobi and being swallowed by the politics of the town. How are we kept in terms of interpersonal relations and the politics that goes around and the cabal of corrupt individuals around the ministries?
How will you deal with it? Then secondly, the shift, NHIF transiting to SHA. I think a segment of it is called shift. Is it prudent? Why not revitalize the NHIF in terms of digitalization, prudent utilization of resources, instead of transiting, which means you could also transit corruption? Lastly, Speaker, it is my view that Kenya is ripe to be a medical tourist destination, just like Turkey, just like Malaysia is a policy on tourism.
The biggest is India.
Yes, thank you. And now being a regional hegemony, you know, we can start with the region, not even beyond Africa, but just as a region. Do you believe that we are ripe to be a medical destination? If so, how? And if not, why?
Nominee.
Thank you, Honorable Member. And indeed, I love your last statement about having Kenya as a tourist destination. Having worked with the World Health Organization, Eastern Southern Africa, that covers the Eastern and Southern Africa region, it's actually based here in Nairobi. It's in the Kenyatta University Teaching and Referral Hospital. It is a regional office. And I have seen the tremendous things that have happened there. We've had expatriates come to stay here with the family, and that has increased. Our Kenyans have been employed through this. Tourism has also expanded, and also some of the products that they buy that are utilized in the office are being bought from Kenya. Equally, as they look into developing infrastructure, most of the time they're using local products. And if they also want to transport these health products, they can consider us. So first of all, I believe that we need to embrace regional partners, not just the country office, the country representatives, but regional partners such as the Africa Union, World Health Organization, among other partners, because they are bringing expertise from abroad, and these are the ones that will strengthen, build capacity, and also mobilize resources. Equally, we need to think about becoming centers of excellence in Kenya. This may not be achieved maybe this time, but it can be a long-term vision so that we capacitate our facilities. A lot has been done in the KU TRRH hospital, among other hospitals, and I think that is the momentum or the way to go in terms of building a capacity and becoming centers of excellence for Africa.
Just to, if you allow me, Honorable Speaker, on the question of medical tourism, yes. You've dwelt much on the aspect of expatriates coming into the country. India is one of the countries that receives the most number of patients who go to live there, stay in their hotels, use their, so it's a big beneficiary of medical tourism. Tanzania, across the border here, there's so many people from the coast who go to a hospital that is called Muhimbili or something. And many of them go there, and they benefit a lot in terms of revenue because of patients going out there. Kenya has just been sending away patients. It has not been receiving. In terms of policy framework and legislation, what would you propose if you are given this opportunity to develop Kenya as a medical tourism destination so that we can reap big in terms of our giving out medical services and also in terms of bringing revenue into, in the form of tourism in the country? What policy and legislative frameworks would you propose?
That you combine with Caliber Mrs. question about medical tourism. Go ahead.
And the Speaker also, the transit from NHIF to SHIF. Or Russia.
Go ahead. Yes, Deborah, go ahead.
Okay. Thank you very much, honorable members. The first thing we need to do is assess and look at best practices from the other countries, such as India. What have they done in terms of building their capacity? And how can we improve? What are the timelines? What are the budget costs? In terms of specialists, we need to ensure that we have top-notch specialists in the areas, and also expand the medical equipment that can be utilized for this. And again, the infrastructure, the logistics, among other aspects that are involved. And so, yes, it is true that we need to have policies with regards to this, but in terms of how to progress, I think that we need to look at the priorities in Kenya. We don't have affordable, accessible, quality of care for patients. And I'll give an example. When I was in Fikiria Jamii, there was a widowed. She had 3 children. She used to wash clothes in Isili. And this lady had developed complications, and we had to send her to Kenyatta Hospital. And so we had to dig deep into our pockets to get money for her transport and her consultation. Once we did that, she went to Kenyatta Hospital, and an array of investigations, including invasive ones, were requested by the doctor. Because they could have cost her an arm and a leg. And for treatment, it would cost her life because she could not afford it. So coming back, I think we need to have our priorities right. And that is offering affordable, accessible care to all Kenyans, the vulnerable, the needy, the orphans, the widows, those who are unable to support themselves. And after that, we can think long-term of having Kenya as a medical hub.
Thank you, Honorable Speaker. Dr. Barasa, considering the recent reports of vaccine stockouts and the shift in policy regarding donor-funded programs like those provided through Gavi, the Vaccine Alliance, what are your plans for ensuring sustainable financing and reliable procurement of vaccine and essential health products during your tenure as a Cabinet Secretary for Health? Another thing is about, and I think Honorable Kareb has asked you, it's regarding the transfer from NHIF to SHIF. To tell you the truth, majority of our people, they are not getting it, and they are not even registering. So I would like to know, to hear from you, if you happen to get this chance, what are you going to do about it? Thank you.
Go ahead, nominee.
Thank you for those wonderful questions. And I will start with the last one, transfer from NHIF to SHIF. The service is to the people of Kenya. And so we need to engage them. They need to own it. They need to understand it. We need to embrace and have community feedback, and then work on it to see how we can intervene. And I believe that that was one of the challenges, that the community was not involved. We did not have robust communication with the community. I think it is critical for us to engage the community so that they understand the vision of SHIF, and they also contribute to see how this vision can come to fruition. Equally, it's important for us to involve the stakeholders, the counties, the county government, partners, among others, to make this come into fruition. So the dialogue is really critical when we are looking to transfer patients. and then we can come up with appropriate interventions. Regarding vaccine stockout, pooled procurement can be done amongst various countries, say for instance in Eastern African region. And then we can also consider talking to the Treasury and see if resources can be allocated, as well as discussing with partners in terms of supporting in the area of vaccine.
Mishimbogo. Honorable Mishimbogo.
Thank you, Honorable Chairman. Honorable Chairman, my first question, it is on the issue of the program dubbed as Linda Mama. This program used to facilitate free delivery by our expectant mother in this country. But right now it has been faced with quite a number of challenges, making women suffer, especially those who are expectant. I don't know if you're appointed, what mitigation measures are you going to put in place to ensure the Linda Mama program or a replica of Linda Mama program is enshrined so that our women will no longer suffer? My second question, it is about the rising mental health burden in this country, where some studies have shown that in every five people, one is suffering from health disorder. And this has been witnessed in our learning institution, especially in our universities, in our secondary schools, where we have seen love triangles cases, we have seen some suicide cases, some reckless killing, and so many other issues. And this issue is compounded by a fragile mental health system, socio-economic challenges, and cultural attitudes. Given the existing mental health policies and action plans, what are the key challenges facing the mental health system? If appointed, what policies will you put in place to address these challenges? That is, the immediate, the medium term, and the long term. And also, is the mental health integrated in the UHC? My last question, Honorable Speaker. No, I have the last one. This is last one. The other time I asked only one question, Honorable Chairman. I just want to ask the last question. Kenya right now has a deficit in terms of doctor-to-patient population. Now with the government directives, which frees new employment and term wage bill, what strategy are you going to ensure that we have more health provided, and especially for those dealing with chronic diseases such as cancers, because we have few oncologists. Also in the mental disorders, we have few psychiatrists. What are you going to ensure that at least we have more specialized doctors? Thank you.
You followed 3 questions. Linda Mama, will you bring it back in its same form or another? What do you do with mental patients and mental health care? Okay.
Yes, through you, Honorable Chair, I'd like to address the concerns. I am a beneficiary of Linda Mama, and my daughter is a beneficiary of Linda Mama. And so I'm an advocate of it. And I will ensure that it's incorporated if SHIF is rolled out. Now, during transition, the transition period, at times such activities may, fall through the cracks, but funds have been allocated from the discussions we were having while I was in WHO with the national team. So we need to have a transition plan or guidelines to ensure that some of these critical covers, like the Linda Mama, are always there when we are transitioning. So this is an area that we look to and ensure that all mothers and the children are covered. I will combine the mental health and doctors to patient population. Indeed, this is not just the doctors, but the health workforce in general. We need to look at how we can protect them and how they can grow in their career. And so I will engage the universities and other training programs, such as the Eastern Southern College of Physicians, the surgical programs, the obstetrics and gynecology programs, and have deliberations on other programs that we can have in the country for our health workers to progress in their career, because we can have even clinical officers, nurses specializing in mental health, in matters oncology, among others. Equally, it is critical, again, as I said earlier, to strengthen community health programs and the primary care networks with mental health specialization or professionals that have been trained in mental health. And so these are areas that we can look into addressing.
Sharia.
Thank you, Chairman. Dr. Deborah. KEMSA has been in the public domain for procurement irregularities affecting donor funds. What's your comment on that? If approved, what policies do you have in mind in safeguarding public resources and the management of KEMSA? Question number 2. Chapter 6 of the Constitution and the Leadership and Integrity Act 2011 imposes the highest standards of trust and integrity for state and public officers. And this is in relation to what my colleague was saying. How do you intend to address the public perception of the Ministry of Health as a mafia house associated with corruption and lack of accountability? What specific strategies will you employ to enhance transparency, restore public trust, and ensure that the ministry operates with the highest level of integrity?
Thank you, Honorable Member, for the wonderful question. And indeed, KEMSA has been in the public domain. What I intend to do, again, is to strengthen the processes and procedures, and that one of the areas is looking at the digital platform, as well as having external bodies conduct routine auditing. Again, visibility and accountability reforms, as well as engaging or a consultative approach to involve other sectors such as ESCC to look into these issues. We need to have transparent tenders, and I will hold my office with high integrity according to the laws.
Yes, Barasa.
Thank you very much, Honorable Speaker. Dr. Deborah, a healthy nation is a wealthy nation. And I want to echo my colleagues what they have said. The health docket is a big docket. It's a very serious docket. And also is a docket with a lot of contestation and a lot of conflict. Having said that, almost 4 years ago, we sent many doctors to Cuba. And also Cuban doctors came to Kenya. We never had any feedback. I really want to hear from you what has been that feedback, whether positive or negative, and if there are any positive things, what is it that we have been able to borrow from the Cuban health system? A second question is, you have been a medical registrar at Kenyatta National Hospital. Across the road, you walk to Nairobi Hospital. In Kenyatta National Hospital, you have the largest Kenya Medical Training College in Eastern Central Africa. And also, you have the largest teaching hospital, university that trains doctors. When you compare the two facilities just across the road, in one you are in Europe, and in the other one you are in somewhere in Africa, not even in Nairobi. Just in case this committee is going to approve your nomination, what is it that you are likely to do so that we are able to see a better facility at Kenyatta? Finally, Honorable Speaker, there are memorandums that have been raised by Albert Gitonga, Henry Fundi, and two others about your practice status at the Kenya Medical Practitioners and Dentists Council. What have you got to say about that? Thank you, Honorable Chairman.
So, in terms of the feedback for the Cuban doctors, I have not been to the ministry. I'll be new to the ministry, and this will be a priority agenda. So I will review, and I'll be able to make a report and share with the Parliament. Regarding the training in the Kenyatta National Hospital and how to make our facilities better, routine facility assessments, identifying gaps, and coming up with international interventions to build up capacity is really critical. And I will be an advocate for that and ensure that we are conducting routine assessment. For my practicing license, I am a qualified doctor. My registration is A6275. I have been in clinical practice from 2007 to 2020, compliant to license renewal. In 2020, I joined World Health Organization. It is a part of the UN agencies. It is an international, independent entity with no affiliation to any member states. I was an international civil servant, offering services to 22 countries in Eastern Southern Africa, and the 47 member states also supported in the Afro region. So my work and my capacity was at an international level as a policy advisor, giving strategic direction and technical advice to various countries in the Afro region. Once the President nominated me as Cabinet Secretary, because of the courtesy and respect and coming back into the Kenyan medical environment, as well as the office of the Cabinet Secretary, I renewed my clinical practice.
Mule.
Thank you very much, Chair, and welcome, Dr. Barasa, to this committee. Chair, I've pursued and I've looked at the CV of the Dr. Barasa. Having worked at Kenyatta Hospital as a registrar, Mata Hospital as a promotion, worked at Eastern Deanery as a physician and promoter, and then straight to WHO. I have no doubt on your experience, but I have a serious concern of where you are coming from and where you are getting into. And I think Cosin alluded to that. We want to hear you, how you will transit. Having been in the medical fraternity for the last 20 years, where you are coming from is where things are done as the policy of the institution. You are joining government whereby complex law, interest, politics carries the day. Madam, with all due respect, I believe you are getting into the Ministry of Health, whereby we have several departments
starting with the doctors themselves, starting with the nurses, the procurement agency, KEMSA, the programs, everything. I want to hear from you your management skill. Or now you'll transit from that set mind of a straight line of thinking, and no wonder you are telling us every time consultation. Here, it is whereby the law applies. The law which is applied at KEMSA is not the same law which is applying with the doctors, enumeration and hiring. So, my question starts with, how do you tell Kenyans you'll streamline supply and demand of health communities in this country to the grassroots level, putting in mind we still have a devolved government? Secondly, from the international community where you are coming from, there are those policies and guidelines which are being given to this country in mass and tier 2. One, Honorable Mukami talked about Gavi and vaccines. You know very well Gavi has been supporting this country for many years to provide vaccines and other commodities. But as a government, we have always delayed to pay these supplies, yet endangering the young newborns and the future of this nation by not being vaccinated and exposing them to diseases like polio. What is your take to how to progress on that? Thirdly, as a country, we are binded by all international commitments, starting with the United Nations Convention on on health policies. And I want to hear from you, how do we get out from donor-funded health programs in this country to a government-funded programs in this country on TB drugs, TB diagnostic tools, HIV drugs, HIV diagnostic tools, vaccinations and distribution of vaccinations to the country, malaria drugs and malaria transmission diagnostic tool. And last, how do you coerce the seamless working relationship between the Ministry of Health and the county government, putting in mind the largest budget within the ministry remains at the national government, and what is required to be transferred to the county government, it is transferred. And lastly, what relationship on working with the county government and the CECs at the county level to ensure that Kenyans does not suffer anymore for lack of health services in this country. Thank you.
Quite a mouthful. Can you answer that?
Thank you, Honorable Member.
Honorable Mule.
Honorable Mule, my sincere apologies for that. Out of passion in matters health, and if hopefully given the opportunity, I believe we'll work together to address some of these pertinent issues. Yes, so again, this will be a priority in my agenda to understand the situation and come back with interventions, seeing that I will be new to the ministry. So the issue of supply and demand, again, we need to strengthen the information system. I think my mind has been focusing on that because I have seen it work. I have seen it work in various organizations that I have worked in. I have seen it being rolled out. I've seen the teething effects, but I have seen the impact it has had. It has reduced on costs, it has improved quality, and it has enabled people to track and see where their stockouts, among others. So we can be able to track the supply of commodities up to the last mile. Yeah? And then we can be able to also monitor other services. So I am an advocate of the digital platform because the human-to-human interface is what is bringing challenges, I believe, in our country at the moment, among other things. So for the vaccines and commodity delivery, yes, we need to allocate budgets to support this, and then we can have pooled procurement of vaccines. We'll also deliberate with the vaccine programs that are currently here, the vaccine production, and see on their effectiveness and their efficiency, and the costs implication. So, coming from my background, I know the concerns, the teething effects of vaccine production, and I know the members, the nominated committee wanted me to talk about vaccine production, but I think it is important that we go in depth and identify all these things before making commitment. In terms of health policy, for the dwindling donor funds, one of the areas we can consider is health insurance, but again, we need to have community ownership. The community need to embrace it because, you know, there are taxes involved. So we'll need to educate them and make them embrace it. With your support, with the county government support, the stakeholders, the partners, I believe we can make this successful. And equally, there are some programs which are again feeding into the universal health coverage, including maternal to child health programs, the TB programs, and so on. So we can see how to work as a team and synergize our efforts for improvement of services in Kenya.
As we sit here, the Kenyans who are watching, and they have been sending some SMSs to almost all of us. A few of them, they say, in case you are approved, embrace biotechnology and diagnosis, harmonize salaries of health workers. They earn different salaries while doing the same job. Somebody else says there's a program called EduAfia for students. It was suspended because of fraud instead of punishing the fraud. Another one says advise her to solve UHC staff menace. They get only half salary for full work. Another one says Linda Mama must come back. That's what Mishi was saying. Another one says ensure SHIF covers ICU costs which are unaffordable by all Kenyans. Another one says, how will you handle monkeypox disease if you are confirmed? And you had answered that. Yes. Yes, Mule.
Chair, I did hear touch on the issue of diagnostic tools as recommended by the UN on the TB, HIV, and also supply of vaccines and drugs for malaria and the diagnostic tools for malaria. Please.
Yes, go ahead.
Yes.
The ones I've given you are just comments extracted from SMSs. Can you answer the members?
Thank you, Honorable Muli, for the question, and through you, Honorable Chair. Yes, this is an agenda that will also be priority in my list to be able to identify the situation and the gaps and the interventions therein. Regarding monkeypox, I'm happy to say that within this year, we've had multiple countries within the Afro region that have had monkeypox. And I have been part of the team that has been supporting the countries. And so I believe that this, with the support, with the support from the National Technical Working Group, we will be up to task to support the country to address monkeypox in terms of readiness and response in Kenya.
Daud, what was it?
Thank you, Mr. Speaker. I want to follow up what my colleague, Honorable Imase Mary, asked about facilities which have not been opened. A case in point would be even Meru, where there is a 5-story building which was done by Honorable Kiraito. He was the governor. 3 years down the road, it's never been opened, and there is congestion in Meru level 5. So there are many places like those. Do you think once you get in, you will say it is not national government, it is county government? What would your position be on those unopened facilities?
Take also from the Deputy Speaker.
Dr. Deborah, also some concerns that have been raised by members of the public who sent me messages. They are saying that the community health promoters are being paid timely from the national government, but the contribution of the county governments comes in very late. I think they have been said that Isiolo County, they are currently on strike because they have not been paid. Nyamira County have not been paid for 9 months. So how will you ensure that the county governments are also able to make their payments as government does, national government does its contributions?
Thank you very much, Speaker. Dr. Deborah, just 2 quick questions. One, there has been worry of staff of NHIF transitioning to SHA or SHIF. They are worried about losing jobs. We have a law that is in place, but they're worried. What is your take on this? Are you going to transit all of them? Are you going to ensure all of them have jobs or others will lose jobs? This is a concern of NHIF staff. How do you respond to them? And secondly, what legislative proposals do you have to strengthen the health sector as you take over, if approved by this committee? Do you have any legislative proposal you want to make here? Because these are legislators and they would support your agenda. Do you have any legislative proposals going forward so that we can strengthen the health sector? Or what gaps are there in the law that you may want to fix to make health a better sector?
Thank you very much, Honorable Owen, and for the questions that have been raised. So I will start with Honorable Dawood's question regarding facilities and their capacity. It is critical for us to monitor the capacity of healthcare facilities to ensure that they are up and running and they are offering quality services. And so it is critical that we conduct routine assessment to identify gaps and come up with intervention. I hope to work together with the county government in terms of identifying the gaps and supporting, because healthcare, the health system is not just the infrastructure itself. It is the commodities, it is the services, it's the human resource. So we need to look at all those things and ensure that our healthcare facilities are up and running. And that is a task that I would wish to take up and in consultation with the counties. Again, the community health promoters, indeed, they are a critical component and a pillar for health service delivery. They are the ones who go to the community, supporting preventive, promotive, and rehabilitative activities. And so discussions with the county government on the gaps as to why they are not, the community health promoters are not receiving their money is really important, and it will again be part of my agenda. Regarding the NHIF, I'm still new to the ministry. I will need to review the HR capacity, the number of human resource that is required for the new insurance, but an intervention can be too much and move the HR, depending on their roles and responsibility, to the new area. So again, this is an agenda that we can have with the technocrats to see where the gaps are and how we can move the NHIF, because it is very sad when, you know, the sole provider of a family loses their job. And so this is something that we need to support our NHIF staff.
Saying that the law that was actually passed in Parliament on the social health insurance and social health authority says that they will all be assessed, and if you have the skill set for the new system, you will be taken. So there is no guarantee. Don't set yourself up. When you get there, you'll get into trouble that you promise you'll hire them. They will be all reassessed, and if they are suitable, yes. If they are not, they will not be taken, because it was said that in NHIF, there are some people even who are geologists and yet they're working there, or nuclear scientists. So their skills don't match the work that they're doing.
Thank you, Honorable Chairman.
You will be the last.
Honorable Chairman, Kenyans have really been crying on the issue of public participation, and that there's so many decisions made in terms of Ministry of Health without their knowledge. My question to the nominee is, are you conversant with Article 232 of the Constitution on the values and principle of public service, and to what extent does your personal and work experience reflect these principles? I thank you, Honorable Chairman.
Yes, Majority Leader.
Thank you, Chairperson, Chairman.
Yes.
My last one, CS nominee. To me, you come across as a very young, diligent professional, but I have doubts in my mind. Will you be able to manage the cartels in Afia House? Because the home of cartels is Afia House. It was Christian Mafia House some time back. Do you have what it takes to fight the corruption cartels in Afia House, in NHIF, in KEMSA? Do you have what it takes?
Go ahead and answer.
Mr. Speaker?
Yes.
I think we also need to be fair to our time and the nominee. That question has been asked several times, so we can't keep on repeating the same. So I think honorable members must be attentive.
Speaker?
Yes.
Speaker?
Yes.
The question of the mafias and corruption was asked, but I think to be fair to the majority leader, he's asked about what he thinks in terms of demeanor. I think it is just more in her direct strategy. And even as you respond to that, I would tell you that the mafias always also say, we have seen many come and go, including the most recent one. So I think as much as that question has been asked, she can respond to it.
Isula is taking over my job.
Women power.
Let's take Raso. Let's not do another round. Raso, just you'll be the last. And the question being asked is very pertinent. It was asked before, as Amisi said, in fact, 2-3 times. Do you have the capacity, the ability, the will, and the strength to fight and resist the mafia at Afia House? That is the question.
To have thick skin.
Thank you very much, Honorable Chairman. Dr. maybe mine is just one quick question. You have worked at the WHO, and there's prescribed number of doctors per patient within a population. What is the standard, and how far are we as Kenyans? Because the UN says 1 policeman to 400 Kenyans. What do they say in terms of doctors, both at the national and the county level per population? Thank you, Honorable Chairman.
Thank you, honorable members, for the questions. With regards to public participation, yes, this is a very pertinent issue of which I am passionate about. I believe there is need for community ownership. And what I see is that the highlight is the taxation of 2.75. We are not talking about accessible, affordable quality of care for all Kenyans, including the vulnerable and the ones with disability. So there's need for robust communication. We need to strengthen communication to the community so that they embrace and they own this initiative. We need to gather feedback and see how we can address the challenges. we need to look at the misinformation and counter it. We need to engage the community. And one of the people in the community that we can use are the community health promoters. And so I think that, or I believe that the risk communication, community engagement, addressing all these things is really a critical highlight before embarking on this journey. Regarding being able to manage the mafias.
You can't manage them, you confront them. That is what you have been asked. You eliminate them.
So, Honorable Chair.
Your colleague who came earlier said you neutralize them.
First of all, we can look at prevention than treatment. And one of the areas is the early warning indicators. We can use a digital platform, yeah? We can use, open tenders or transparent tenders. And we can use independent bodies to monitor this. And engaging the EACC and other bodies in this.
Go ahead.
In the discussion. So I think we need to strengthen.
You have the courage and the will, that is the question, to confront the mafia and defeat them.
I will hold my office with high professionalism and high integrity.
Good.
But she can't manage and treat mafia. She has to deal with them head on. She has said that she's going to manage and treat. We can't deal with mafia as like that.
I think she's understood. You can't treat the mafia, you fight them. They are a criminal enterprise. And exactly.
I think the Honorable Mukami did not get the nominee right. She said there can be preventative treatment, and my understanding was that preventative in terms of preventing corruption, if I got her right. And what she was talking about, curative, I think is what she was now explaining in terms of working with other agencies. It's only that she's a doctor, she's using medical parlance.
Okay. The last question from Raso. What, from your UN perspective, is the doctor-patient ratio in an average society like Kenya?
No, we are not quite there, but we are doing well compared to other countries in Africa. So we need to look at improving the HR capacity, not only for doctors, but other cadres such as the nurses. Yes.
What are the numbers?
The ratio. What's the ratio?
I will have to confirm the ratios. Yes.
Okay. Now, a few formal questions. Other members, a few formal questions. Do you hold any leadership position in any political party?
No.
Have you ever been adversely mentioned in any integrity-related report or investigation?
No, Honorable Chair.
What is your net worth in terms of wealth?
Okay. So my net worth is a combination of mine and my husband, and it's 455,845,320.
You and your husband?
Yes.
Honorable members,
that is, Mr. Speaker. Mr. Speaker.
I think because
yes, Caleb.
Yeah, because this is a House of Records, so I propose we divide into two.
Chairman, it is not necessary to be divided into two. It can be another way.
Don't break families. Yeah. If they own it jointly, if there's a dispute, the courts will decide.
$455,845,320.
Okay, millions.
Yeah.
Yes. Honorable members, the nominee, according to the clerk, has submitted her papers and are all in order. 7 memoranda was were received from various people, and in her written response, she answered all of them. You are now released. Yes? Yes. Yes. You are now released to go back with your original documents, which will be given to you by the sergeant behind you. And have a good day.
Thank you. I'd like to again thank His Excellency the President for nominating me as Cabinet Secretary, Ministry of Health, and also for the nominated committee for giving me the opportunity.
Appointments Committee.
The
Appointments Committee.
Appointment Committee for giving me this opportunity to also present myself. And I am happy to bring my expertise and serve the people of Kenya.
Good. Bring the next nominee. Members, do you want to break and resume at 2? How many minutes?
5.
10 minutes. Lunch is served in the boardroom of the commission. Those of you who are hungry.
We've just eaten a snack.
Yes.
5, yeah.
10 minutes. We'll do lunch after the next nominee.
kuna meeting na sijui lakini sioni nikienda. Nimewaambia nimeanza kwa ndafuta MCK number. Hacha nikuje niweke. Hakuna kitu unaandika. Ja. Uinuliwe. Tunashuka. Hapa nimechoka. Anastai huyo alinifuata.
I think you can step out. Although kuna yule mwenye alikuwa nafaa kuja
step in.
But you could just cheza ukipima kichelewa.
Ndio. Huko ndani. Allah, nilikuwa nasema umeenda. Hapa siwezi tuacha tu nisifikie hapa. Ndio nilikuwa ndani. Ile meza shika tu. Nitamwambia Masi nilikupea shilingi yangu.
Umekati zote? Sioni kama vile mtu anapita. Nenda mkaa kudeni. Hapa siwezi kushia hata kuangalia. Na mimi ni mkubwa.
Ama ukaile kiti ya kwangu arudi.
Nani?
Huyu kwenye amesimama huyu. Kwa kwangu alikuwa amekaa hapo la arudi.
Arudi. But unaona mtu anakuja na yes.
Hawaingii. Naona kuna shughuli huko juu. Ndio nini sasa mnaingia na nini?
Sergeants, bring the next nominee. Honorable members, the meeting is back to afternoon, Alice. Maybe I should not call you Alice, I should call you good afternoon, nominee.
I think I feel nice when you call me Alice, Mr. Speaker. And maybe I should also call you Chairman. I don't know, I need guidance.
Yes.
If you are both.
I'm both. Honorable members, I think we are ready to go. Sergeant, can you administer the oath? Alice, you have a choice between, what are you looking for?
I had two people, I can't see. With your permission.
Your support staff or your security? Here you are secure.
No, yes, not security. It's a support staff, just one person.
Yes.
Murefu.
Good.
Thank you.
Ako hapa?
Ako hapa.
Okay. You have a choice between the Bible, the Quran, and affirmation. Which one?
The Bible.
Depending on your faith.
The Bible, yes.
So you may be upstanding and take the oath. Take the Bible by your right hand and read the standard oath.
Thank you. I, Alice Modoni Wahome, do swear that the evidence I shall give before this committee on the matter under its consideration shall be the truth, the whole truth, and nothing but the truth. So help me God.
Thank you. You may take your seat. Alice, if you have your documents, pass them on to the clerk so that as we proceed with the process, they'll be verifying your originals against what you submitted. Welcome to this approval hearings of vetting. I'm the Speaker of the National Assembly and Chairman of the Appointments Committee. On my right is the Honorable Gladys Boss, Deputy Speaker. Sarah Kyoko is our Deputy Clerk. I will invite all members to introduce themselves, starting with Naisula.
Naisula Lesuda, MP Samburu West.
Nelson Koech, Belgut.
Kosing David, Poko South.
Gikaria David.
Mase Mary, Teso South.
Abdul Rahim Daud.
Ferdinand Kevin Wanyonyi, mjumbe wa kwanza Trans Nzoia County.
George Gitonga Murugara, MP Tharaka, Tharaka Nithi County.
Owen Baya, MP Kilifi North.
Robert Mbui Kadhiani.
Stephen Mule.
Didoraso Saku.
Mukami Washira, Nyeri County.
Lastly, Caleb Amisi Saboti.
Welcome, Honorable Alice Wahome. This is a distinction for you to be vetted twice by the same committee within the same political term. We vetted you some time back in 2022, and we have received communication from the President that he has nominated you to the Ministry of Lands, Public Works, Housing, and Urban Development, the same ministry that you are here. We invite you to introduce yourself. We are conscious of the fact that you are a former colleague in the House, but for the record, introduce yourself, your name, your educational background, your experience, your key competences, and your suitability for appointment as Cabinet Secretary within 5 minutes.
Thank you, Honorable Chair, to this appointment committee. Sorry?
Chairman or Speaker? Not
Yes.
Chair. I'm sitting on a chair.
Chairman, although I would prefer chairperson, but I'll go by the chairman. Thank you very much. I think it's awkward. I think I just prefer to use the speaker. Thank you, Speaker. My names are Alice Modoni Wahome. I'm an advocate of the High Court of Kenya. I have served as an advocate before, prior to the nomination in 2022. My last certificate as an advocate was for the year 2022. Thereafter, I'm a graduate, therefore, of the Nairobi University Law Faculty. Since then, I have served as an advocate in practice and served in
When I last checked, it was called University of Nairobi, not Nairobi University.
The University of Nairobi.
Yes,
I had said the university, and I take the correction, the University of Nairobi, where I finished in 1984, and then went to the law school in 1980, up to 1985. I got admitted as an advocate, and therefore, since then, I have had the opportunity to practice both as a state counsel in the Attorney General's office and also as an advocate in practice. I've done a lot of advocacy, human rights defense, and activism, you could call it that. I have served as a member of the Law Society of Kenya, served also as an advocate, as a vice chair for FIDA and other women rights organizations. I have then had the privilege to work as the Member of Parliament for Kandara for 2 terms. I served from 2013 to 2017. Then I got another privilege to serve 2017 to 2022. And then I still got the opportunity to be elected a 3rd term in 2022 August, when this government came into place. I got the privilege, as you have rightly said so, to be nominated as a Minister for Water, Sanitation and Irrigation in September 2022, where I served until October, 5th of October 2023. And then I was moved from that ministry by His Excellency the President in the exercise of his mandate to the Ministry of Lands, Public Works, Housing and Urban Development. I have served since then until the 11th of July this year, when I was dismissed under Article 152(5)(b). I think I will say that in terms of my competence, I am a team worker. I take a lot of pride in working within the team. I have had the privilege, prior I have talked about advocacy and training and litigation as a litigation lawyer, but within the Ministry of Water, I did various matters, various things in terms of the work, which was new to me that time. And my handover report speaks for itself. It talks about non-revenue, reducing non-revenue, coming up with frameworks for reducing non-revenue water. In water, we also were able to come up with a framework for water purchase agreements to work within the framework of PPP. We did several boreholes, several strategic plans to raise funding to the tune of, by the time I was leaving, we had about a total, including the Kenya budget, we had a total of about 80 billion for water. I was able to understand the mandate very fast, and we raised the water coverage from 65%, the national water coverage from 65% to 72% by the time I was leaving within that short period. And then sanitation from 26% to 32%. Now, in the Ministry of Lands, where I have then served for those other 10 months, now I believe this was my 10th month, we have various programs that are running, and therefore I would say that in terms of the work that I have been doing, and I'm very thankful to His Excellency the President for returning me back by way of this nomination back to the ministry that I have been for the last 10 months. I find that as a confirmation in one way or the other, or expression of confidence that I did my work for those few months properly, and subject to the approval, I'm willing to serve the country in that capacity. There are a lot of challenges in the ministry, but in terms of competence as a lawyer, I do not find myself as a stranger. For example, in the State Department for Lands, where obviously there are matters that I had done before. I was exposed to conveyancing, but I was not exposed to some of the challenges that are there, including fraud, including cartels, including bad practices, which we have, with the support of Parliament, I'm sure we'll be able to overcome. So I'm a team worker, I'm a hard worker, I believe in hard work and honesty, and I have the right aptitude to carry out my duty as a minister.
Yeah. Thank you. I'll invite the Deputy Speaker to fire at you the first question.
Okay, Honorable Wahome, I'd like to ask you this, and because it's one of the questions that most lawyers are asking. There's been the ongoing digitization of land transactions and records to curb corruption. There's been the rollout of RD SASA, which was having a challenge, and I know that also you had the ministry's strategic plan 2023-2027. Could you tell us what you are already doing in regards to these three areas, but also what you would do, and that you feel that there's still challenges going forward if your confirmation of your nomination is made? Thank you.
I thought you said you have some support staff with you.
The question is what we are doing in respect of the RD SASA, the digitization and digitalization system within the ministry, the Department of Lands. And that there are several questions coming towards that particular strategy to deal with the land. One, this particular program is meant to bring efficiency to secure land records and to provide maybe surety that the security of the records will be maintained with integrity. The program started way back in 2014, and where we are, I could safely say that we have been able to cover the entire Nairobi with about, which has about 300,000 titles, and you can be able to access the RD SASA platform, and therefore we are at a better place. But I still know that there are a few records that we are still working on loading. And of course, with the huge developments that are coming up, we'll still require to have a bigger space in terms of that platform so that we can capture land in real time, be able to give records to the public in real time, and accessibility becomes easier and more assured. The story of missing files should be one of our bad history, so that this is a system that we should encourage, embrace as an information management system. What we have moved now to Murang'a, to Isiolo, to Mombasa with the same system, and we are already working in another 27 registries where we have been able to take our scanners, because the first exercise you do is to network within provide the infrastructure. Then you do the scanning of the records. You know, our records have been manual. We want to, of course, to get rid of the manual records. Not completely throw away the records, but be able to know that we have the information system secure, properly secured. But then the records are put on, on board, loaded. With that, then we can be able to say that I want to be very honest with the Parliament, because I'm at the right place. We needed a better budget, a bigger budget, to the tune of between 35 and 40 billion to be able to secure all our records under the digitization system. And of course, the country needs to be able to have fiber networking in those other places. And therefore, another maybe 5 years, we can safely be able to do this, provided that we get sufficient budget as a country to cover it. And yeah.
Majority Leader.
Mr. Speaker, yes, nominee. Your
gadget is not working.
No, it's working now. Thank you. CS Nami, I will not ask questions of if you are approved, because you have been the Cabinet Secretary for Lands for at least a year or so. And you are aware there have been very many cases of land grabbing around the country. And we've also seen you on TV on some land which was alleged to have been grabbed somewhere in Loresho. And you also know of many other cases that have been brought to your attention, or the attention of your office, your former office at the Ministry of Lands, around Windsor and other areas. Cases where your ministry officials, officials of the National Lands Commission, those from the police have been involved. I would want to hear what you would do, if approved, or what you have been doing to curb the rampant cases of land grabbing, and especially considering the recent court judgment by the Supreme Court that a title by itself is not prima facie evidence that you are the owner of, legitimate owner of land, that one needs to go beyond that face value of the title to check how that title was acquired from the initial first owner. And you're aware, many of the cases that you have been dealing with are cases where land is illegally transferred from the bona fide owners to land grabbers, and with the protection of or facilitation of officers in the Ministry of Lands, and protection of other government officers, including the police, they take away people's land. What is it that you have been doing to address that, and what will you do that will now completely curb that vice? Lastly, is your engagements with the National Lands Commission. I would want to hear your firm commitment to respecting independent constitutional commissions like that of the National Lands Commission, knowing their boundaries between the work of the ministry and independent commissions like the National Lands Commission. What is your position on the role of the National Lands Commission vis-a-vis the role of the ministry that you have been working in? Thank you.
Go ahead.
Thank you very much, Honorable Ichung'wa, for those questions. It is true, and it should be actually a national tragedy to have the fact, to have a situation where a title is not prima facie evidence, necessary prima facie evidence of ownership. When I was going through my university law course, I knew that title, and the land law that was taught is that title is sacred. The title deed is almost, it's almost absolute, but it's no longer the case because, as you have rightly pointed out, we are aware of very many cases of fraud being carried out by Kenyans with the support of sometimes unscrupulous...
You mean Kenyan criminals? Because not every Kenyan is carrying out fraud.
Kenyan fraudsters.
Yes.
Kenyan fraudsters and cartels. And they are not just, when we say cartels, I want to clarify. They are powerful cartels, they are managed cartels. Some of them surprisingly have made money through those kind of fraudsters, but then maybe cleansed that money into institutions like schools, like banks, like other maybe real property investments. And they are also powerful. But of course, there are also the ordinary cartels and criminals also who don't have much money, but they are part of the whole system. And I have come across very many, and some are very sad cases, because people have, the cartels have reached a point where they don't respect the title deeds, and sadly, many times, or quite largely, the officers of the ministry have been, in numerous cases, part and parcel of procuring those kind of titles. When you look at the Land Act, to be able to deal a big blow to the cartels when they secure fraudulent titles, and you, Honorable Speaker, I mean that you are the owner, say, of this particular building, cartels come and they perform some miracle and procure another title, where your title is safely somewhere, maybe under the locus of this particular building or parliament. And that title is the normal paper that we use for titling in this country. But other times it could be that paper, but the signatures are superimposed, or signatures of former commissioners of lands, maybe former registrars, both dead and alive. Not that they are the ones who signed, but some of our retired officers have also been part of that cartel. They've been signing. Some in their death, they are said to have signed. And therefore, what am I doing? I think we need to work on some amendments very quickly on the Land Act, so that the minute the registry, the technical information on the land records are known to be interfered with, to have been fraudulently secured or changed, so then the registrar, say the chief land registrar, should be able to immediately effect a cancellation and leave by law, because the minister is the custodian of all land titles, and therefore be able to say this record should look like this, and so that the person flagging another title out there should be left to be the one to have the honors of going to court to prove that the ministry has changed records or altered records, and that these are the true records. What has happened is that the ministry, previously the courts have taken the position that a title is sacred, a title can only be cancelled by the court. And you know, for the court to arrive at a position where it is able to say that these are the records, truly the evidence must be produced before the court by the chief land registrar or through his officers, so that then the court can be able to rely, will always rely in a good judgment, well-reasoned judgment, the court should be able to summon, or the owners of the case to be able to call for witnesses and the right records to inform the court, to help the court arrive at the right decision, is evidence from the ministry. So therefore, there is no reason why we should, as a ministry, not be able to rectify the records. When you look at the current section 79, yes, it's not clear that you can be able to alter that title. Anyway, Mr. Speaker, I have been asked what I have been doing. I have been utilizing that section. Severally, I have impugned some of the documents because they are obvious frauds, and therefore I'm not willing to take the dirty work of my ministry to the courts. Let the person alluding or alleging that they have a good title go take me to court, and that should happen to the same for everybody. What has the fraudsters have actually taken that section and utilized it in their favor, and you know they have the money to influence, to pay lawyers, good lawyers, and eventually you may be the owner of the title and find yourself losing. It has happened. We have several cases in the High Court, others in the Court of Appeal, where people, genuine owners of land, are struggling with judgments that don't make sense at all. And I do not want to go beyond that, but they don't make sense, and they cannot. So therefore, we need to change the law to some extent to be able to give clarity to what the registrar should be able to do in the event that there is a clear fraud. I have taken the position that I will tackle the fraudsters. I have found myself in one of the notorious cases. I was actually locked up in a suit premises, not a suit premises, in a property that is clearly the records. I found the records had actually been already rectified. The records were okay, but there is somebody also claiming they have a good title. And I was locked by goons within. I think the police were part of the system, so that even when we entered there with them, as a minister, Honorable Speaker, and if there is one time I feared, is that one time, because it was down the valley. Even if it meant me running up, I would have had a challenge to run the hill up. And these are young goons who have been put to guard this property. Maybe you should ask, why did I think I should go there? I'm taking this fight to the crime scenes, Honorable Speaker. And I'm willing to do that because once I have established that this is a title, either for schools, for institutions, because these people have stolen land right, left, center. A lot of government land has been taken away, including prisons land. Institutions have lost land to them, to either people working within or people working within those institutions and other people. So I am taking the war to the crime scenes. And I believe that I need a lot of support from the police for purposes of enforcement. And but with the law, the answer is really dealing a big blow by use of the law, so that it is clear what we should do when we are faced with those kind of things. Yeah.
Junet.
Thank you, Chairman and Speaker. So, Mr. Chairman, my question to the nominee is, first, Madam Nominee, can you tell the committee in the period that you are there as a Minister for Lands, you have been, as you have just put it now, you have been following up grabbed lands and land that have been grabbed. Can you mention which public land can you say you have recovered from grabbers as of now? And secondly, whether it was necessary for you to go to that scene, what necessitated you going to that place? Because how many land can you visit as a minister to go and that is a security issue, that is the enforcement issue. But more importantly, there was a bill that was authored from the ministry, the Lands Amendment Act, that was withdrawn by the majority leader. And you wanted to take the powers of the National Land Commission completely. What necessitated that? What was the reason behind why you wanted to usurp the powers of the Independent Commission? And lastly, the issue of disappearance of files in the Ministry of Land still exists. Kenyans go to the Ministry of Land, RD House, they can't find their files. And we have been told that land was being digitized since when the former cabinet secretary was there, Farida. Up to that time, up to now, from that time up to now, digitization is still going on. But files cannot be traced. When will this issue of disappearance of Kenyans' files end, Madam CS? Thank you very nominees. Thank you very much.
The Honorable Ichongwa had asked the same question on the, what is our mandate vis-a-vis the mandate of the National Art Commission, and are we respecting the mandates of the, is there any issue? As far as I'm concerned, Honorable Speaker, there is no problem or challenge. We've not had any conflict or fight between my office and the office of the National Land Commission. In fact, I would say that I am having quite a cordial working relationship with the chairman and his commission. But that does not mean then we abscond or we abandon our duty, and therefore each has their mandate. Our main mandate in relation to titling is we are the ones, the minister is the one who does the leases. In fact, all leases in this country are signed by the minister. I would say not my signature, but for the minister. So I take responsibility for all the leases, including those that are going around there that are fraudulent. Secondly, we also do the title deed or the certificates of title. That's done by my registrars. So to that extent, then, our work is different because the National Land Commission's main mandate is to manage public land, administration and management of public land. And the amendments that we were proposing were speaking to the valuation. I still think that I will be able to come and persuade Parliament that valuation of government projects land, compulsory acquisition should be, the valuations should be done by the owners of the project, by the government, because we are the, you see, the National Commission is an independent organ of this country. And therefore, if it is the government that is doing its projects, there is nothing wrong in them doing the evaluations between the buyer and the government. And therefore, I think those are some of the amendments we were proposing. That does not take any power of the commission given under the Constitution. I think you could talk about maybe the law, but anything that is not working for the government within the law then requires some changes. You are aware that we have had a big challenge as a government by overstating and overvaluing you may not be able to confirm in terms of the valuations, the integrity and the authority of that valuation. The chief government valuer is under my ministry, and therefore that is something we've been in the leases are, what they do is to provide allotment, is to allow allotment and give no objection for allotments to be issued by the county governments, and therefore ensuring that public land is granted to only those who deserve to be granted the public land. And we have no dispute in respect of allotments of land between ourselves and the national government. So in terms of going to how many places can I go, if I can go to 5 or 10 and provide the statement that is needed to stamp authority of the government in terms of telling the cartels that I'm here and I will not allow, and I can tell you, Honorable Speaker, it has worked to some extent. But I said what I need is the law to be explicit, to be clear, to be able to tackle the problem of cartel. Otherwise, nobody is safe with their title deed if we are not going to deal a death blow to cartels. And I'm willing to walk along that journey with the Parliament.
Thank you, Chairman. I'll just make a brief comment because I was going to also ask some questions on the amendment bill, number 2 of 2023, but since it was withdrawn from the House, I will not dwell on it in the House in Parliament. I'll not dwell so much on it, but just to let you know, in case this committee approves you and the National Assembly, if you rethink of bringing it back, please look at some of the clauses that I need, because from the events of this that happened in this country 2 months ago, you have realized that we have a very informed population in this country. And so that issue of NLC had come up, and Kenyans were with issues of land, and you know how land is emotive. The second thing that was on it that Kenyans raised was the issue of inserting a new clause which will force freehold land owners, property owners who enjoy free ownership for perpetuity and can use the land for any purposes to pay land rate. You know, that was just a comment since it has been withdrawn. So to my question, one, who is a cartel? Every CS nominee talks of a cartel. I want you to explain to this committee your definition of cartel. The second question is the whole issue of the housing levy. By April 2024, the government had collected in excess of Kenya shillings 34 billion. How many houses can you confidently say have been constructed and completed as we speak? And lastly, with the Finance Act having been declared unconstitutional, I think yesterday, do you understand its import on the housing project, and what next if this committee then finds you suitable to hold that office? Thank you.
Take another. Nelson.
Thank you, Honourable Speaker. Mine is actually very brief. Affordable housing is one of the key pillars of Kenya Kwanza administration. In fact, the president has been many times quoted as saying it was a deliberate way of creating employment. I want to ask you, Honourable nominee, how many young people have been employed by this program? And number two, do you think this program is sustainable, and is it working?
Go ahead.
Thank you, Honourable Speaker. I think it is important that even though Honourable Lesuda has not come by way of a question, for me to make one or two clarifications in respect of the authority and the mandate of the National Land Commission. Because many times there is misinformation or misunderstanding of the mandates. And I believe that there is no misunderstanding between ourselves and the National Land Commission. Sometimes it's just propaganda. If you look at Article 67, the functions of the National Land Commission are to manage public land on behalf of the national and county governments. 2, to recommend a national land policy to the national government. Indeed, I have one document already recommended, and we are working on the national land policy, reviewing it since 2009. The review is supposed to take place every 10 years. Then to conduct research related to land and use of natural resources and make recommendations to appropriate authorities. To initiate investigations on its own motion, that's regarding complaints, historical injustice, and all that. And then finally, then there is to encourage the application of traditional dispute resolution mechanisms to assess tax on land and premiums on immovable property in any area designated by the law, and to monitor and have oversight responsibilities over land use planning. So I believe that the bill, one of the bills was Honourable Leader of Majorities, and the other one was my bill. there was the very sticky issue that was floating around, which was actually an incorrect position, that we had planned to change freehold title to leasehold titles. One, it is practically not possible within the law for me sitting as a minister or any of my officers to change land tenure from one regime to the other, meaning from leasehold, freehold to leasehold. But with the application and consent of the owner, it is possible. So there was no provision that we had brought to do that. What raised maybe concern is the proposal to levy some charge or some fee on freehold ownership within our cities. Let me clarify again. The levy that we had proposed in the bill that was withdrawn was levy on freehold land within cities. So far, by the description of cities under the Urban Areas and Cities Act, we have Nairobi, Mombasa, Kisumu, Nakuru, and Eldoret is soon coming on board because it has been approved. So 5 cities. But the...
Chair, sorry to interrupt the CS, but because you are House of Records, and she has mentioned a bill that I have sponsored, which what she has said is not accurate. The bill that I had sponsored initially is what then became the Owen Bayer bill, amending the National Lands Commission Act on Section 14 and 15 of the National Lands Commission Act to vest powers to the NLC Act. What Honorable Lesuda was asking is regarding the bill of the Land Amendment Bill number 2 of 2023, which I withdrew, which came from
which was
ministry.
Our bill, yes.
And the issue she has raised is the issue of rates on freehold land. And in the bill again, it was not clear whether it was in cities. It is actually the Committee on Lands of the National Assembly that in their report proposed that you limit that to cities. So I think is good.
Yeah, the process was ongoing. I agree and I accept.
What came from the ministry is not what you are saying.
The bill was ours, but there were many proposals to amend even that bill. And so far, maybe the argument is, I'm making this for clarification, that there was no proposal for rates because rates are not payable to the national government or the Ministry of Lands. Rates are payable to the county governments, and they are doing their own review of rates. We were proposing a levy or a charge on freeholds because freeholds within the cities then therefore are enjoying facilities and they are paying nothing. And maybe I could say here that if you look at where the freeholds in this country and in this city, for example, using Nairobi, Honorable Speaker, is that the freeholds are within the Karen, the Muthaiga, the Lavington, and it's important that I say maybe some areas of Kirereshwa, Kitisuru, Kiuna, those upmarket areas. Why? I think it was a skewed way of raising tax against some people and not everybody. So that if you go to the whole of Eastland and the Southlands, then you will find that, areas of all these areas, that I haven't mentioned, they are paying rates and they are paying land rent, both. And therefore, in other countries, what is happening is that if you have a freehold, then you pay, including any other land, you pay some development tax because the land that you are sitting on is actually has been developed to equal. In this country, then, we are having some people paying and others are not paying. And I think that is a conversation that we'll be able to bring back to the National Assembly for debate and discussion, and also robust public participation and debate. And I don't think there is nothing wrong in saying that, but we must understand that in other jurisdictions, what is happening is that there is payment of, against charge against land where developments have come and they were not there before, because anyway, these developments must be funded by either the land or by a taxpayer. So, and I think that is what was taken to mean that we are charging a charge on freehold, and there is likelihood.
Alice Wahome, you are being too wordy.
Yeah.
You can say what you are saying in very concise terms.
Yes.
Yes. Yes.
The Speaker,
I believe I have maybe exhausted.
Hold, there's a point
Yes.
of order there.
Yeah.
The Speaker, it is good to have clarity on this matter because that bill was as well a controversial bill. It is very important to have clarity here that the proposal that came from the ministry was that all freehold land be changed to leasehold in the whole republic. It is Parliament, a committee of this Parliament, and that's why Parliament must be given credit where they do their work, that is suggesting to them that we should maybe do it in cities. But the ministry, what they brought to Parliament was that they want even the ancestral land that somebody is holding a freehold in Migori. They wanted to change it to leasehold. For what? She should tell us why, what was informing that, instead of now hiding under Parliament.
Alice, why?
The provision was saying that the minister will be able to say, to designate the areas, which then means you designate through regulations, and I would still have had to come to Parliament to be allowed the designated areas that we would have picked. So, and therefore, the proposal by Parliament, I commend. I think it helped and it improved the provision.
Mole?
Thank you, Chair, and I'm sorry I didn't want to interrupt.
You have interrupted, just go on.
Chair, we are in a vetting process, and the leader of majority and the leader of minority have stated the actual position. But the nominee, she's trying to run away from the reality. The reality is that the bill which came to the House exactly wanted to levy even the ancestral land in this country. And it came from the ministry. She was the CS. So instead of using too many words, please admit we move forward. Because at the end of the day, Kenyans could not accept your proposal. And it came from you. It did not come from the House of Parliament. Speaker. It did not come from Kenyans. It came from your office.
Yes, sure.
Yes, Alice.
Speaker, I said that the proposal had indicated that the minister will designate areas where the levy will be. It was not blanket, because it is not possible to collect.
Point of order,
it is not possible to collect levy in the entire country.
Mr. Speaker,
yes.
That is true. But why do you want to subject a land that is in Bungoma or Migori for a minister who's sitting in Nairobi to designate whether it will be a freehold or a leasehold? Why do you want to do that? Just say it was wrong to do that, and now you are rectifying it. You are agreeing with Parliament for that issue to become a city's issue. Just and we move on, Madam C. You are a former member of Parliament here.
I think the clarity I have made, I have even given credit to Parliament, but I have said that it is Parliament that was going to give me permission to say where to levy the. Yes.
Point of order.
Okay.
A brief one.
Yes. Yes, Naisula.
Thank you, Speaker. And I just want to put it to the nominee, and from what the majority leader had said to another nominee here, that one of the challenges of the cabinet that was there before is communication. Because Kenyans are not understanding what you want to do. When they raise questions, it is said to be propaganda, but now we have confirmed here today that it is actually the truth. And so I think moving forward, if you're confirmed, and the last thing also is when there is public participation, and Kenyans have an issue with a clause or with a matter in a bill, it should be discussed thoroughly and given the view of those because the bill could be good, everything else could be good, and we have one contentious issue. Could we exhaust it? Because I can assure you, after what happened in Parliament, these parliamentarians will not be a rubber stamp anymore to any issue that will be contentious, Madam Nominee. So that is all I wanted to do so that we could make progress.
Yeah, thank you. I would hate a parliament that is a rubber stamp. It's of no use to anybody, even themselves. But, and I agree with you, this bill had not even gone to second reading where the debate was going to happen. And during debate, the proposals for amendments would obviously, by the House, I think the subject was still...
We'll make progress. Alice, what the members are telling you is that a bill came from your ministry with these contentious proposals to the House. When it was picked up and spread like wildfire, the ministry maintained a conspiracy of silence. Instead of coming up to say, it was our bill, we withdraw it so that you quell the fire, you said nothing. But that is, let's move on. Posing?
Thank you, Speaker. I think there is need for better communication. Yes. I agree with you throughout the entire government, including my former ministry.
Yes, even His Excellency the President has said, lamented, that one of the weaknesses in the government is poor communication. You're doing good things which nobody knows. And when you do bad ones, you don't own up.
Questions on housing levy.
Okay. Yes,
Speaker. We proceed to the housing levy question. I was asked by Honorable Koech how many people or youth we have employed under the affordable housing levy program. I want to confirm that in our records we have about 106,000 youth, both men and women, and I want to add here that most of them are youthful, below 35, and we ensure also that we include women because we have women who have the skills and artisan skills, yes.
Youth has no gender, it's just youth. Men and women.
Sometimes when you say a man, it is said it is also a woman, but until you say it is both male and female, then there is a problem. So thank you, Honorable Speaker, but I would say the youth, it can be youth, women and youth, or youth men. Yes, so we have ensured that gender is also observed in terms of those who are working and benefiting. Is it sustainable? It will be sustainable if we are able to continue with the housing, affordable housing levy. And I'm aware that it is also still in court. Would I say that up to now we have over 100, we have at least 48,000 housing units that are in different stages of construction, between maybe 20% and 95%, some nearing completion. In fact, we expect that we will be launching several of those units this year. And so it is sustainable because this is one of the best projects and programs that the country can allow to continue. Everything else bad said about it, but this one in terms of employment and in terms of self-sustaining, if we can allow the levy to continue, it is sustainable. And I bet that what we are giving, including allowing housing to people who previously cannot access and afford decent homes, then I would think that the country should take it and proceed with it.
I thank you, Honorable Speaker. And if we were to be direct to the question and answer, I would say we are almost spending 1 hour only for leadership of the House. We have not even had anything ourselves. So, Speaker, what is mine? Mine is this. Nominee, Honorable Alice Wahome. This issue of house levy or house tax, of course, was very controversial, and it is still controversial. However, because it is in place, it is mainly in urban. It's only in urban. And the people who are paying are in the villages. And most of us in parliament, we represent village constituencies. About 80% of this country is village, or 70% for that matter. And even if, and you know, the government has run to talk about jobs, creation of jobs. My view, Minister, is, if you are confirmed, what will be the housing plan for the rural people who are also paying this tax and paying this levy for people in towns to enjoy houses and to enjoy jobs? Nobody in my constituency or constituency rural who will enjoy those jobs. Nobody will enjoy those housings, right? But we are losing money. So what is it that we are advising even the president or the government in terms of saying, these guys in the rural are paying these taxes or levy, but this is our housing plan for them, so that we can actually move as a country. Thank you, Speaker.
Gikaria.
Thank you, Chair. Me, I will only ask questions that have been raised by Kenyans. The chairman of the IDP camp in Nakuru called New Canaan is asking, after the settlement of the court cases referring to Donga Farm and Kisima Farm, when is the ministry intending to do the titling? Secondly, there is a guy from Joro asking about Ndefo plot in Menengai Slopes and whether there will be titles, whether you will be giving titles to that place called Ndefo plots. Thirdly, is a teacher in my constituency asking about...
Point of order, Mr. Speaker.
Yes.
Mr. Speaker, not to interrupt my colleague, I think those questions can only be answered by the minister when she is in office substantively. Whether she can give me a title or not. She can't give anything now.
Honorable Chair.
I was about to tell
she's jobless.
Honorable Gikaria, you are assessing the suitability or otherwise of Alice Wahome being reappointed Minister for Lands. Now you're asking her to issue titles.
Sorry, let me rephrase.
Under what authority?
Let me rephrase.
Yes.
Assuming she's appointed to that, assuming she's appointed to that position, Honorable Chair, because these are pertinent issues, Honorable Chair.
On another point of order,
yes.
I think Honorable Junet's point of order was very legitimate, because the questions Honorable Gikaria is asking, even if the minister is approved, are the questions that we change our standing orders for, to cause the minister to appear before the House to answer such questions. These are not questions for a vetting process.
Alice, answer.
I think in
Gikaria, you have relayed concerns of your constituents.
Thank you very much.
Which are not vetting questions.
Maybe the last one, and that is related to the affordable housing.
Go ahead.
Is related to the program. Is a very good program for purposes of employment. But the contractors who are given that do not come and actualize that by adhering to the labor laws, by paying, say, for city rates or the rates that are there in the labor law. Maybe what action will she take to confirm that this will be done? And
if she's confirmed.
Thank you.
Again, she can't take action unless we say she'll be a minister. Now, but you can answer those.
I think largely in terms of titering, I want to say that we are not on course because we need better funding for titering. The total number of, in terms of percentage, the country has about 30% of our land titled. Meaning,
Alice, who has asked you that?
Because
the questions they asked,
on the titles.
Holding, Posing just asked you about how do rural folks in Kenya benefit from housing levy?
I'm
very
answering
simple.
Gikaria.
The second one of Gikaria was, will titles be given to some 2 farms? So it's not titling generally.
Let me say that I think you saved me from answering Gikaria's question.
Yes.
And then we leave it at that.
Are you the one I told last time about reading a book of a witness who talked too much?
No, not me.
It was not you.
Not me.
Yes.
And I'm sure.
I think it was Linturi.
Yes. So I will leave that question. On the question of IDPs is gone. Affordable housing in rural areas.
Yes.
This is a new program, Honorable Speaker, Honorable Members. It's a new program. It's just starting, and it has been met by various challenges, including litigation. I believe even the rural folk are entitled to decent housing. I see the program moving there going forward.
Mary Amase.
Thank you, Chairman. I had two questions, but one of them has been, I think, prosecuted well. It was on the proposed levy on land.
Very good.
But I would want to say, Chairman, that there is need to improve the communication in terms of public participation. Probably going forward, we need to change the law so that members are involved in doing public participation with the people we represent, so that we disseminate the information and then bring our feedback. But Chair, I want to ask on collapsed buildings. There are reported incidences of collapsed buildings across the country, which have resulted in injuries and loss of lives and property. Oversight of the construction industry falls under the ambit of the State Department of Public Works. So my question is, what has been done to address these cases and to avoid future incidences? In your view, are these measures sufficient in resolving the issue?
Alice?
It is true the regulatory authority, that is NCA, has the mandate in terms of ensuring that only people who are qualified are contractors. But the problem is not just about contractors. I think the problem is deeper. We have people taking shortcuts, and some people also, we need to work collaboration with the county governments, because some of the buildings coming up do not even have plans, so that even the issue of the National Construction Authority or enforcement should start at a further place at the county level. And I think that we need to do our work better. We need to strengthen the Public Works Department, Honorable Speaker, and ensure that in terms of national work, both the national work and the private work, because most of the buildings that collapse are public. But also Kenyans need to work better and ensure that they do their buildings using professionals. There is a lot of shortcut in that regard. So that the Kenyans should be also their own watchmen. I mean, the government cannot be everywhere. I think government is doing its best, but Kenyans must also start building with integrity, meaning applying the law and the regulations.
Daud?
Thank you, Mr. Speaker. I just want to comment on one thing before I ask you a question. From your CV, you have said you're a member of parliament from 2022 to 2027. So does it mean you were not a minister? I know you were elected until 2027, but you had to resign to? No, it's in her CV, that's what I'm saying. So you need to correct your CV.
I will look at that. It was only 2022.
Let me ask you my question now. Adjudication mistakes on land are normally sometimes done at the lands office, and it costs people to rectify those mistakes in acreage or size or whatever, about 18,000 shillings to rectify. And not just that, you have to pay, initially you had to pay 150 or 300 or 500. That charge has now gone to 3,000 shillings. And there was no public participation when you increased the charge from 300 to 3,000 shillings. Somebody has got 10 parcels of land under adjudication, has to pay 30,000. That's even before you factor in other costs. That is one question. The second question, what is your take on the Dungu Land Commission lands, which were cancelled, which there is a report regarding the same? The last one is regarding affordable housing. You have talked about it. and my colleagues have talked about it. And there were grand launches by His Excellency the President, who has nominated you to that ministry again. But unfortunately, those housing were just launched and they have not taken off. And like Honorable Laisuda has said, there are 24 billion in that account. So what is that money doing if it is not being used? And those lands are, those housing projects are just stationary. Thank you, Mr. Speaker. If you allow me another one, but I think.
Ferdinand, take two.
If actually you are appointed as CS, I want to find out, because you going around, you will find yourself, there's a lot of upcoming, like you go to a place like Mathare and other places which are congested. There's no plan at all on, so that you find people living in a very affordable way. What plan do you have to be able to at least streamline some of these upcoming dwelling facilities that actually are causing problems? You will find that even getting electricity in a place like that is not there. And somebody staying in a place in Mathare, and water is actually passing through her house. So what plan would you have for that kind of thing? Secondly, I come from Trans Nzoia. This affordable housing scheme, have you actually ignored Trans Nzoia? Or what is happening when it's supposed to be countrywide projects that's supposed to help people in areas that Trans Nzoia, where people actually also need those affordable housing?
Alice?
I have not picked, let me start with the Trans Nzoia. I haven't picked this specifically, but if we have no affordable housing program coming, I think I want to assure you that the first entry to the affordable housing program is the 290 constituencies. Every constituency is supposed to be a beneficiary when we roll out fully of a minimum of 210 housing units. So yes, we will be there. And of course, there with the available land, I won't say when, because it's a program that as soon as possible, maybe we don't even have land in your place, so you needed to work with the ministry to get land for that. And I'm not saying there isn't, because I don't have my document with me. I believe in Trans Nzoia County, we already have some affordable housing programs coming up. Who are you? Yeah. We do have. It's okay. We will be there, and I'm sure that it is every other wish of member to work with the ministry to ensure that they are there faster than maybe the event plan. Yeah. Then the slum upgrading, we have a very good slum upgrading program. It's the one working in, for example, in Kibera. We are in Mukuru. We will be going to Mathare, and therefore, what I can say is that the government needs support for the affordable housing program. The houses for the slum upgrading is even cheaper. Those houses are even cheaper than the social housing, and we have a lot of goodwill in terms of funding.
Just hold there. We are now classified as a middle-income country, right?
Generally.
Kenya. Not generally, we are classified.
Yes.
We are not a HIPIC, highly indebted poor country, we are not. Now, when you talk of slum upgrading, is your policy to eliminate slums or to upgrade slums? How do you upgrade a slum?
That could be the terminology that we are using, but basically, you know, we are providing the necessary infrastructure. water, ensuring that the necessary facilities, including electricity, connectivity, and is available, and roads. And the program is well funded by the UN, the European Union, World Bank, and also AFD. So I think that the question is, why are we talking of slum upgrading instead of slum eradication? Maybe that is something we can think about and change the name.
No, I think if I have understood her well, Speaker, she's saying they want to make slums habitable, that people can still live in slums, but they become better place where they...
That cannot be the direction of our country.
It is not. It is not. It is basically, once we work, we eliminate the slum. So possibly we need to change the wording of that program, the title.
I think, thank you, Mr. Speaker. Let's begin by saying maybe that concept of slum upgrading is not our concept. Yes. The financiers, you've talked about them.
Yes.
Those are the people who brought that terminology, because you build for me nice things up country and a slum upgrading, and it's a misnomer. Two questions. The first one is on housing levy. We are interested in this because we are told we have actually collected lots of money through those levies, and there was a report in the papers that the peers had actually invested the money on treasury bonds. That sounded a little bit odd, but you may need to confirm whether indeed we do have that surplus, and that is the route we are taking, while at the same time, His Excellency the President has taken another route of saying, instead of just affordable housing for people to buy, we will now put up hostels in institutions, which I think is a very good program that would go side by side with the affordable housing. On land, again, if you are confirmed, we have experienced the President going around the country and interacting with the people. They come up to him to say, we do not have title deeds, and we need those title deeds. And he makes generous promises that in 2-3 months, I'll be back here to give you the titles that you need. As the person responsible for policy, are there policies in place where you can actually carry out those premises without having to embarrass the head of state, so that those down there do not say he gave false promises, etc., etc. You're able to carry out to the letter when the promise is made, it's actually executed.
Alice, Dawood is protesting that you didn't answer his question. Yes. And then Dungu report, go ahead.
I asked about the adjudication, about the Dungu report and the affordable housing, where nothing is going on. And you've got 24 billion in the account, putting in treasury bills or bonds.
Yes, Minister.
I could start by looking at the Dungu report is a very good document report, and I know that several of the properties that are within and picked by the Dungu report will clearly indicate the kind of cartel that I was talking about. I know I was asked to define what is a cartel. I think, in short, a cartel is a thief. It's a thief for land. The Dungu report is a lot of, I don't have the figures, but some of the land recovered has been recovered through the EACC, because we have institutions, some we have had to go to court through EACC, and it is work in progress. The report is still live. That's what I would say. Affordable housing, everybody wants affordable housing, but there is also recognition that there has been a lot of disruption on this particular program, both by cases and therefore implementation, and that's why we had some money not able to implement immediately, because when you have also cases going on, you need first to understand where you are. And it is not that there is surplus. We have also already procured for all that money you are talking about. What happened, Honorable Speaker, is that the last financial year, 2023-2024, we had a balance that was not utilized because payments had not been done to the tune of about 38 billion shillings. And it would be reckless to hold money into a general account without investing it, even if it's short term. So it's not that it's being invested because there is no work. We have 106,000 housing units. Right now, we are releasing the newly procured ones, over 55,000, and therefore, I want to confirm that that money is already taken up, plus, of course, unexpected, maybe annual income through the levy of about 62 to 63 billion shillings if the Kenya revenue does its work properly. And I think that is the amount we expect so per year, about 63 to 65 billion shillings. So the 38 is part of the budget that we presented and will all be spent in this year. So Dawu, I want to encourage you. I believe that I'm here to seek support also for my suitability, and when that happens, then if that happens, I think on my part I should say if that happens, then we should be looking at. Meru is a beneficiary of some of our affordable housing. We've come there with the president, so maybe we have not reached your constituency.
No, Speaker, they have launched with His Excellency, put the stone.
Your question
but
is that we have
not
not
moved
started.
even one way, and they've got the money in the account while she was the minister. That's why I'm not saying if she's confirmed. While she was the minister, it has not moved.
Sometimes, Honorable Speaker, I appreciate the concern of the Honorable Member. Sometimes lack of takeoff is because of various things. Maybe documentation, perfection is not complete, logistical issues. Sometimes even when we do proper investigation, you find that the contractor who had said that they are able to take off sometimes get a bit of delay, and we are supporting even local contractors. So I don't think it's a case where we are that so strict. We are working with our local contractors, and sometimes logistical issues, and thank you, Honorable Judet, for once. I know it is a very important key issue in terms of implementation.
Yes, Owen.
Thank you, Honorable Chair. I want to just to ask one question, one very important question. Cabinet nominee, land in this country is one of the reasons why we had the 2010 Constitution. It's one of the key aspects, and it actually gave birth to Article 67, which formed the National Lands Commission, where people from regions that for a long time had had issues on land, especially historical land injustices, that gave birth to Ndungu Report, Njonjo Report, and many other reports, pushed and voted. My people woke up very early in the morning to go and vote for the new constitution, not because of any other thing, but because of land, especially the coast. Today in Parliament, over 80% of the petitions we receive are actually on issues related to land and security. Now, looking at it, it becomes, therefore, it requires leadership, strong leadership to actually finish these issues of land. But the National Lands Commission, I don't want to belabor the issue of National Lands Commission because you've answered many questions, is one of the key planks in resolving the issues of land. People knew there was a ministry, but then they set up the National Lands Commission so that they can solve the problems. So the minister and National Lands Commission must work together to ensure that eventually people get justice in terms of historical land injustice and review of grants. Nominee, I am reliably informed that since you became CS, you have never had a meeting with the board, the National Lands Commission, a formal meeting to actually sit and discuss issues and give leadership in the sector. And I think this is bringing issues as we move forward. But, Honorable Speaker, what I would like to say this. We have moved amendments to amend the National Lands Commission Act so that we can extend their mandate in the review of grants and hearing historical land injustice. But the biggest impediment has been the ministry, including a letter that we received from you dated 24th April, which is signed by you, that you know there are certain issues. When the committee called you for the meeting to discuss these amendments, the committee said that the minister did not make an input. But when we passed the law in Parliament, when it was going now, we are supposed to send it to us, and we respected your letter, and actually these were my amendments, and we held back. But the vibes I get, if I can use that word, the vibes I get is that probably the minister does not want the National Lands Commission to exist. She wants absolute power to run whatever she wants, the show in the land sector. And they're
making a speech. Can I ask a question?
So my question is, do you still believe that we should not review the law, especially section 14 and 15 of the National Lands Commission, to give them power to review grants and to hear historical injustice? I mean, do you still believe we should not review that and deny the National Lands Commission the power, or you have changed your mind about it?
In those many words, he's asking, are you hostile to the National Land Commission? And have you ever met them since you became minister?
Maybe I will repeat first that I don't know where your information is coming from, Honorable Member, but I said that I enjoy cordial relationship with Otachi Garrison, the chairman, and his commission. That is one. We have not had any conflict, either by exchange of letter or by verbal exchange. So the source you have could be a very biased or an incorrect source. I am working with them. Remember, they are also an independent commission, and their mandate, they must also not encroach on the mandate of the executive, because their mandate is very clear in the Constitution, and I have no personal interest or ministerial interest or executive interest to encroach on their mandate. But they must also remember there is also the clear mandate they have, and we have. I have met them, Honorable Chair, in various meetings, formal meetings. I have met the board, and when the chair also confirmed that the board is coming, some of the members did not come, and I don't want to go into that, because the commission, I think you need to summon the commission yourself as Parliament. The commission has its own challenges. I think it's right now maybe a bit.
You say you have no problem with them, then continue to list their problems.
Not myself, person, their own challenges, not between me and them, Honorable Chair.
Okay,
that's what I'm saying. Maybe the reason they are not working is the challenge between, but not between me. They have handed over during a formal meeting the national land policy, because as their mandate, they recommend to the ministry the national land policy. We have had a whole morning meeting, the entire board led by their chairman. So, and the chairman also paid a courtesy call. We have had other mini meetings for various things with the chair and any other commission that has an issue to deal with at the ministry level. So, I'm okay.
Speaker.
Microphone.
Amendment of section 14
I think my
and 15.
take would be the take of everybody else. I mean, I work for the country. If those provisions, that particular maybe amendment you are talking about, if it is subjected to public participation and debate and other stakeholders and it goes through, then I wouldn't be the one who would hold it. But I don't want to sit here and say that it's okay, because it may not be okay for many other stakeholders.
Thank you, Mr. Speaker. Honorable Alice Wahome, this Ministry of Lands has been cited as corrupt from time immemorial. And the issue of, even when you watch news, many times you find people have been, kicked out of their houses because of the issue of fake titles, which you've addressed very well, I must say, because you've said you have a way of dealing with the fraudsters. Even if they have to go to court, let them go to court. But my question is, what action do you propose to take if you are approved on the staff of the ministry that are clearly, in many instances, involved in the same fraud? Because you've given us a direction on what you do with the fraudsters outside, but what about the staff? Because those ones are your staff. And secondly, when Kenya Kwanza came into office, there was the promise that the issue of evictions and demolitions of people's homes would be a thing of the past. You saw over 10,000 people kicked out of their homes in Mavoko, and that still continues to happen. In fact, recently, I think some people are kicked out of some estates within the city of Nairobi. And compensation given was definitely not enough, and part of it never even got to the registered owners. How do you, has the policy changed? And if so, how do you, what do you want to tell those Kenyans that have such issues and are concerned?
Let's take, we're going this way? No, we're coming that way. Amisi?
Speaker, for starting where I am. Speaker, I've been quietly listening to these proceedings. I may not be a happy person because I expected, we vetted the nominee before us 2 years or so ago, and she has served in various portfolios. I expected a progress report, sort of success stories from where we posted her. But I can just see a lot of verbosity on this and this. Land issue, land issue, Speaker, it affects even the public offices. If you look at the audit report of parastatus and the government agencies, 90% of the audit is just on land, either ownership, one entity taking another one to court, one parastato, and it consumes a humongous amount of money between legal fees and accounting fees and the surveying fees. So it is an area that you do not just, talk about it in the passing. So I wanted to hear from the nominee. Yes, she has served there. She's going there back. I don't have your progress report so far. But the issue of parastatals and the government.
You say she's going back before we decide?
Yes, if she's approved. Yes. The issue of parastatos and the government agencies taking each other to court on land issues, is there a policy statement that you can solve it once and for all so that we save this country a lot of money that is being used between lawyers and the legal firms in all the parastatos, virtually all of them, and the perennial historical land injustices? I come from Kitale, and I think you've been there. You've tried to come across the land issue of the Kitale prisons, and it is across the country. We are perennially in constant problems with our constituents and the grabbers and landowners and the government entities perennially. Can it stop once for all? Can we have a progress report from your ministry going forward?
Answer the question by Robert and Amisi.
From Robert, what am I doing with my staff? What have I done with the staff that I have said that sometimes they are part and parcel of the cartels? Since I got into the ministry, we have had 4 arrested officers and charged in court. There is another 3 under disciplinary processes. And therefore, I think to that extent, and have had a meeting with all the registrars in the country to restate the policy and the position of the minister and government in terms of this business of participating in fraud. And they know, and we have many other cases with the DCI, and I think there will be likely other officers that will be taken away by those cases. I think I could say to that, and I have also said that I intend to come back to Parliament to sharpen the provisions that will help to deal with the fraudsters. Then you asked, I think the question on kicked out, I don't understand that one. Demolitions of people who, Madare and elsewhere during the rain season. I think half of those people had already suffered a big blow for being within the riparian and the watercourse area. And even those who were affected because of building along the river were also calling for government intervention to be provided for with homes. We have, I think the estimated numbers, if I'm not wrong, and those would be mainly with the Kindiki, because of interior coordination, was about maybe 20. The rough estimate that came to the cabinet was about 20,000 Kenyans that were affected by the demolitions. I think demolitions are right now not going on, but it was so that they are removed from already insecure space along the river, where in any event they were being devastated by the floods, because we experienced out of the normal, maybe beyond the normal of the floods or rainfall. Therefore, I think going forward, as a government, we need better, maybe, these are emergencies and you require maybe money to be able to settle those kind of people. So I think everything adds up with, do we have funding to be able to resettle them? They were given 10,000 and some, I'm told some, I think there is information that some may not have received, which is still not sufficient, but it was a gesture for people who also, Kenyans must stop also building along the rivers. I don't know, I know and I understand and I believe that these Kenyans don't have maybe better places, but remember some of the people utilizing, some of those people are not the owners of the structures. The structures could be owned by people living elsewhere. I mean, on government parastatal, I think land moving from one maybe person to another, parastatal fighting each other and cases in court. I have already proposed to the executive that we circulate, before I left office, that I think in June I proposed that all the departments, all the ministries forward to the ministry the list of their properties so that we can now start cracking holistically so that we have a one government approach in terms of recovery. I was given approval to circulate that request to call for departments to forward all land that is said and known to have been grabbed. We will be working on that. Of course, I will require police, I will require the investigative agencies, and I will require the EACC. And I think then it is, whether I'm the minister or not, Kenyans should be prepared to move from government-owned properties because it is public wealth, it is public property, and it is horrible where, as the situation where we are, and I agree with you, we should give it a one holistic approach so that we clear with it once and for all.
Thank you, Chair. Honorable Waziri, I just want to ask you one question regarding the pending bills, because I understand there are many pending bills in your ministry. I need to know how you are going to sort it out, considering the current financial state at the moment. The other question is about compensation. There are many Kenyans who have given their RAD to the government, and they've been waiting for their money, and it's like it's taking too long. Thank you.
Ms. Shimbogo.
Asante sana mwenyekiti. Nitauliza maswala mawili, swala la kwanza kwa lugha ya Kiswahili na swala la pili kwa lugha ya Kiingereza. Swala langu la kwanza, Mheshimiwa Wahome ambaye umekuwa waziri katika hii wizara kwa muda mfupi, ningependa kujua mikakati ambayo utaweka katika wizara yako na kupitia serikali kuu ya Kenya Kwanza ya kuhakikisha ya kwamba Wakenya wengi ambao wamejenga kwa miaka nenda miaka rudi katika zile ardhi ambazo zilikuwa zinaitwa GL ama government land, na zile ardhi ambazo kuna absentee landlord, yani wale wamiliki hawajulikani na hawako, na pia wale ambao wamejenga katika ardhi za wale wamiliki ambao walipatiwa ile tunaita grants ama zabuni, rubuni, na watu kama hao hawajafika katika sehemu hizo na wala hawajulikani, kwa sababu kihistoria wakati wa nyuma kulikuwa na siasa zile ambazo mtawala akiingia anaweza kupatia marafiki grant ya mashamba katika sehemu tofauti tofauti, na jambo hili limefanyika sana katika sehemu ya bonde la Ufa na sehemu ya Pwani. So ni mikakati gani ambayo serikali kupitia wizara yako itafanya ndio tatizo hili la mashamba liwe historia, isiwe kila wakati wa siasa, wakati wa kampeni Wakenya bado wanauliza maswali yale kwa yale? Na niweze pia kuweza kukubaliana na Mheshimiwa Owen wakati aliposema ya kwamba kuna tashwishi ya kwamba huenda pengine wewe, na hiyo ni hisia yangu, ukirudi katika wizara hino utaweza kuendelea kuhujumu tume ya ardhi, kwa sababu wakati mmoja ulikataa kuongeza muda wa kushughulikia mambo ya historia za mashamba, na tatizo hili ni tatizo nyeti katika bonde la Ufa, katika Pwani na Kenya kwa jumla. Kwa hivyo hivi sasa umesema ya kwamba mambo yatakuwa tofauti, tunataka tuone ya kuwa tofauti, kwa sababu tatizo hili bado liko, hatujaona ya kwamba kama tumefaidika katika mambo ya dhulma za kihistoria za mashamba. Swali langu la Kiingereza, what specific timeline?
The Kiswahili version was just a speech. Now ask the question.
Mwenyekiti, hilo ni swali na nafikiri Mheshimiwa Wahome ameelewa hilo swali nilivyoliuliza. My second question, Honorable Chairman, what specific timeline did you establish when you are the Cabinet Secretary for the Ministry of Land for the completion of digitization of land records across all the counties? How many counties right now they have those digitized land records? What is your roadmap? Many times we have been putting some allocation in terms of this program of digitization of land records. So what are you telling? What is the status right now? We want to hear, because we know this is the only way where we can avoid some cartels, we can avoid some corruption and so many other anomalies. Thank you, Honorable Chairman.
Thank you. Sharia, we can take Sharia as well.
Thank you, Honorable Chairman. I think you're teaching us something new of saying no chairs. And Mheshimiwa Wahome, significant parts of the country are formerly trust lands and fall under the Community Lands Act. It's public knowledge that the community land legal regime remains not fully operationalized, and if granted, has not been regime not fully operationalized. If confirmed, what possible solutions do you propose? I thank you, Honorable Chair.
Can you answer those, Alice?
Chair, from Honorable Shurie, trust lands, it is true, this, most of this is what we call as community land. We have the Community Land Act 2016, and the Community Land Act is operational. We are registering community lands everywhere in the country, but it is a slow process because the communities, the members of those communities must sit and agree, prepare inventory, and it's not an easy process because also we have seen that leadership sometimes within the communities is infiltrated by politics, but the preparation of the inventories is quite a tedious task because every member is supposed to sign, agree and sign, and then have that inventory forwarded by the office of the governor under the law so that then you can start the process of registering. But we are on course in terms of various counties, and I believe we need the support, in fact, of elected leadership to expedite those processes as a government. Then Mheshimiwa Mishi is asking, I believe what she's asking me is a policy issue And in terms of absentee landlord and people who have moved and become squatters on people's lands, we are in the process, Mr. Speaker, of finalizing the national land policy. It is a matter that should squarely be captured there, so that as a country we agree what to do. But also, we must not encourage, there is a lot of criminality in some of the people in terms of moving to people's land and becoming professional squatters. Those must be discouraged, but there are also genuine squatters that the country and the government need to work with and work on, that require sometimes the government to raise budget to purchase those parcels where the squatters are, and then do a land settlement in terms of the squatters. So the program in terms of land settlement is ongoing, is a program of the government. We need more funding for that. The government needs more funding to deal with that, Honorable Mishi. But I agree with you, there is a lot of this problem in terms of absentee landlord. Let's have policy, and the policy will be brought to Parliament, and the input of Parliament would be very critical in terms of handling those. Then I think extension. Honorable Bayer, you accuse me of maybe being the person rejecting. I hope, Honorable Member, you haven't been given the wrong card in respect of my activities in terms, this particular, the commission has not come to me officially or formally to say they want to extend. And in any case, the term of the commission in terms of historical land injustices was limited by the statute, not by the minister. Opening that would require an amendment, but also we must, and I, as a minister who has served, we must caution the country that we cannot have historical injustices for land perpetually. We need to be very careful, and also if we open, we must limit that to a certain period, because we are talking about historical, not current. Any other current injustices can be done within our courts of law. We talk about historical, and that's why there was a time limit. Sorry, Honorable Speaker, I think there was a question on the digitization. No, not yet. There was the question on digitization, where we are. I had said earlier, we've done Nairobi, Mombasa, we are ongoing. Isiolo is more or less complete. In another 1 month, we'll finish with Isiolo. Murang'a is basically on board. Then we've gone to Machakos. We have 27 counties that we are working with currently. And I wouldn't be able to say specifically. I had estimated that to do the entire work, we may require another 5 years if funding is properly availed, and I have had talked about between 35 billion to 40 billion Kenya shillings to do the entire exercise.
Thank you very much, Mr. Chairman. Honorable Alice, land is a factor of production. And where I come from, land actually is a major source of conflict. And the many questions honorable colleagues have raised, it is indicative of that, whether you are in urban or rural areas. The first question which I want to pose to you is this thing called Ardhi Sasa. The major problem, and that is why Kenyans are angry, is because a simple transfer of land or property from one individual to other take maybe 1 year or 2 years. If really we have a platform, if really it is digitized, why would it take inordinately such a long time if what you are explaining to the committee is seamless? Secondly,
I think the issue of corruption in land, it is not just simply said. I think it's profound. Examples are everywhere. In the county of Marsabit, we largely live on community land or trust land. But what is surprising, there are individuals who hold titles in areas that have not been adjudicated. And when they go to the ground, they are told, show us the extent of this land, and they cannot. So what is simply happening is those individuals who are involved in titling are the ones who actually are illegally issuing illegal title deeds. Going forward, if the House is going to approve your nomination, what is it that you are going to do differently? Because, Honorable Speaker, I have to make this point. From what Honorable Alice has given the committee this afternoon, I think that committee may be running into headwinds with you, simply because you need to carry leaders along. Because land is not just anything. Land is about community, it is about people, it is about settlement. So people must really be carried along. Thank you, Mr. Chairman.
Thank you very much, Mr. Speaker. And I want to ask the nominee. She has a broad ministry moving from land, public works, housing, and urban development. And as a nominee, you must have a vision. And I want to ask the first question is that, what is your vision to sustain urban development in the 47 counties? And how do you plan to address the challenge of rapid urbanization in terms of planning, in terms of giving blueprints of how the water supply will be done, roads construction will be done, the issue of electrifying those urban areas, and the issue which is very fundamental of sewerage in most of upcoming towns within Kenya. Secondly, the State Department of Planning Public Works launched the National Building Code 2024 on 17th of July 2024. The code is expected to update the standards and the requirement in the construction industry and aims to resolve the various issues affecting the Kenya building economy environment. If approved, how would you support the execution of this code? Various associations, including the Association of Construction Managers of Kenya and Interior Designers Association of Kenya, have raised concern concern on being unrecognized by the code. What is your opinion and what is the remedy of this? In prayer on my first question, when you get to that ministry, are you able to give...
When or if?
If you get to that ministry, are you, and do you have the capacity to give a vision of how do we want our towns and our urban areas be planned so that we can have proper coordinated construction, which includes the housing program? You are also in charge. The last one, the assistant chiefs.
Mule, one question at a time.
Okay, can I finish with this? Can I finish with this?
You've hit two already.
This is the last one. As the Minister for Housing, and you are in charge of this ministry, and to implement the housing program, what do you visualize on how the common man at the village, the assistant chief, the chief, who is paying the housing levy to benefit from the housing program in this country?
That question has been asked 4 times. Yes.
Yeah.
Yes, but I think it is important to Mule.
Maybe I can start with it and say that I had said that I see this program of affordable housing is a new one.
Stages and is spreading.
And I see it going forward. I see it going to the rural areas as well. But for now, we are within urban centers. For obvious reasons, infrastructure, facilities.
The next question.
Yeah. Mukami had asked me about pending bills, Honorable Speaker. The pending bills, we have about 18 billion legacy or pending bills. Some of them from cases that are filed against the ministry. And these are being considered as part of the national pending bills from other ministries where a decision must be made so that we agree as a country how we deal with all the pending bills, including verification processes. That is a process being undertaken with the leadership of the National Treasury and the Executive. So we will have decisions made together. Compensation, I don't understand which compensation, because compensation in terms of compulsory acquisition is done by the National Land Commission, and basically that is not within my mandate. Any other compensation, maybe by judgments, those are pending cases or pending bills. I believe I could start with the question of Adisasa had been answered, but I am saying that this really, I'm thinking that we should get accommodation, because it's now real time possible to access your records and get information regarding your land records, especially when somebody else other than you want to access your records. You are the one to approve. I think the challenge for me is how to move faster to the other, maybe not now for me, for the ministry, for me if I'm approved, but for the ministry, the challenge is how to expedite. And I had said that with the necessary funding, it is possible to expedite. There is an issue you raised regarding titles in Marsabit or even elsewhere. Let me also warn the members, just alert the members and the public that it is not all titles that are out there that are actually valid titles or are titles. They could just be papers with no worth of a title deed. There are many, some are just made at Liver Road, like some of the cases the Honorable Majority Leader was raising, title papers. When you look at them, they look like they are genuine, but they are made from River Road and they cannot transfer proprietary rights to any property. So I don't know what you are referring to in Marsabit. I think it would be important for me to have the records so that I'll be able to know what you are dealing with or referring to, or the ministry to be able to be brought to their attention so that they can maybe stop whatever could be happening. And I agree it is profound, and the land issue is obviously very emotive. So therefore, community land, be part of the community land processes so that you can help to expedite the community to have their land put in a title, because it's private land. Community land is considered as private land for that community. The rights are the same, so they would need to come back together quickly so that there is no land left without title. I think security would be secured by that. Individuals involving in titling from my ministry, I had agreed, and I also said we have a few we are processing in court. My vision is the vision of the ministry. The minister doesn't have a vision personally, but the ministry has a vision in terms of urban development. And in terms of urban development, we have the Urban Areas and Cities Act. And that is specifically addressing the problem of rapid growth of population vis-a-vis the facilities available in our small towns. And that's why the KUSIP, that is Kenya Informal Settlement Program and Kenya Support Program for the urban areas has been developed, which of course is basically focusing on the facilities we have in all the towns, small and big, so that the planning becomes a condition, proper planning, PDP preparations, and all those physical planning for the land use and for the development use are part of the conditions for accessing the funding under those programs. So in my view, if you ask me what is the vision, those programs are for between, they are 5 years program, but looking forward, we need very elaborate cooperation between the county governments, because you know they are the ones in charge of the planning at the county level, including survey work, so that then it is possible to have properly planned towns now before they become fully congested. My ministry, with the leadership of the Directorate of Physical Planning, former ministry, I beg your pardon, Mr. Speaker, has sufficient capacity to be able, and of course we can always increase capacity as a government, to be able to guide the county governments, and they always draw back for purposes of planning, and they seek support from us. And of course, we have the Physical Planning Act that requires also to be maybe reviewed to capture some of the issues that you are raising. So my vision is to see well-planned towns that have all necessary facilities of a big town, but even better planned than our big towns like Nairobi. You cannot say that it is properly planned, but we can now have better planned towns. As they grow bigger, then they have the street lighting, water, sanitation, and every other, yeah. And of course, including titling.
Thank you, Alice. Yeah. Alice, let me ask you one or two questions. Under Schedule 4 of the Constitution, distribution of functions between the national government and county governments, you have the responsibility for housing policy and the general principles of land planning and the coordination of planning by the counties. For the period you have been minister in this docket, have you ever had a meeting with county governments to discuss the issue and coordination of planning by those counties? I ask this because if you look around the country, we have completely misstepped, so to speak, in our planning and land use activities. Anybody with the land touching on any road just wakes up and builds a shop. In the old days, if you look at all the urban areas and markets, they were designated, meaning it is possible to easily provide security and amenities such as water and everything else. What have you done, and if you are confirmed, what do you plan to do to effect this constitutional responsibility?
Honorable Chair, it is not the easiest to actually work with county governments, you know, and for government, national government has been having its own challenges in terms of intergovernmental relationships. On my part, I haven't had a meeting with the county governments as a whole, but we have worked with different county governments or governors in terms of their planning. And they have brought their planning documentation to the ministry, and for sometimes for even for support in terms of that planning, and ensuring that it meets the thresholds that are required. I think going forward, I would say that it is necessary that I meet the county government in terms of the institution itself, the COG, so that we can agree. But they also think that the national government is encroaching a lot on their mandate, and they refer a lot to Schedule 4. And I do agree that quality standards regulation, and of course capacity building is some of the things we are doing under the Kenya Urban Support Program. Within that, my ministry before me has held several meetings with the county, with the COG, and the CEO of COG has been a constant, and I think she's done a good job for the county governments. Yeah, has worked well with my ministry.
Some Kenyans sending messages to us.
Yes.
Why did she take sides with the Kirima's land dispute when she came into office?
I didn't take side with the Kirima land. I took side with the owner of the land. It could have been any other person. And when I pronounce myself as to ownership, sometimes it helps in terms of dispute resolution, and that is what it is. My task is to say who is the owner, and I said that it's a long dispute, and at that time there was no outstanding court case.
Another Kenyan says the nominee has declined to answer a question from Dawood on how fees was increased from 300 to 3,000 without public participation. Another one says implementation, this is actually a member of parliament called Andon Watch, that you've ignored the implementation of decisions of the House of Parliament on matters that have been brought to your attention following decisions in the House. Another person called McDonald Walbengo says, why has the ministry not processed titles to public institutions and schools? Because my grandfather donated land to a school, and to date we are unable to get our own title and give the school the title on the land we donated. That's a very good Kenyan. Other Kenyans would go to grab the land back. Another one says, who are these cartels with government documents that the minister is talking about? Another one says, rich people are buying land from less fortunate people, transferring the land and refusing to pay. What is the minister doing about that? Those are comments from Kenyans.
I think for schools, it's an important, very important question.
Is the one of the schools.
Yes, we have titled over 14,000, going to 15,000 title deeds for schools.
And I actually, Alice, know of a school.
Yes.
That was given land by a generous person, and his grandchildren over 50 years later came because the school had no title, took away the land, and kicked out the school.
Yeah, I think previously the institutions did not just schools, actually most government institutions, and maybe that is one of the tasks that we should achieve, do not have titles for those properties. And the titles are supposed to be produced and held.
If you are confirmed, can you have a Marshall Plan to issue title deeds to all public institutions within a year?
Okay, those without issues, it is possible.
Yes,
as you emphasize on that public institutions, I want to add, including KICC. Yeah, thank you, Speaker. You know what I mean? Yeah. Including KICC.
Honorable Speaker, I
know that. Go on.
Sorry.
Ignore that and go on.
As she knows. Thank you, Speaker.
Honorable Speaker, let me clarify on schools. We have over close to 15,000 schools that we have under our program. There is a program for titling of school titles, you know, and we have covered close to 15,000. The total is about 31,000. So I think we are on course. Possibly we need to expedite in terms of that. A few have disputes about 1,500, but the balance we are working on, a balance of another maybe 14,000. Ruoch says I have ignored the House of Parliament. I am not aware of any area that I have ignored. Maybe it has not been brought to my attention. And should I be approved, I would want to engage him personally or get him to. Yeah, I know him. I don't know what he's referring to. The fees that the member of the public, and it's important, is there was elaborate public participation. The fees of 300 shillings, 500 were fees that were for 1980. Prescribed, when the act was actually, basically it's over 20, 30 years. And so we reached a point where we reviewed, and there was elaborate, and there is records of public participation. And I would also seek that Kenyans agree to support, because it's their government. Yeah.
Alice, you are so wordy. If there was public participation, just say so.
Kenyans out there have said I haven't answered.
Yes.
Yeah, so I wanted them to understand, yeah.
Lastly, Alice, do you hold any position in a political party?
Not at all. Yeah.
Not at all? No. Have you ever been adversely mentioned in any integrity-related report or investigations by any agency?
Not at all.
Not at all. Do you hold citizenship of any other country apart from Kenya?
No, only Kenya. And I have no interest.
What is your net worth?
I think that one I need to be my net worth is
what did you tell us?
About, where is that document? It's about 300, net worth is about 300.
You don't know your wealth of head?
No, not of, it's mine and my husband. So maybe what? It's 300 and what? $327,650,000.
How much were you worth when we last vetted you?
I was worth slightly less. When you vetted me, Mr. Speaker, last time, I was worth 218,400,000.
You have had some nominal growth.
Kidogo.
You've grown by 100 million.
I have grown in those 2 years. Yes. Yes. I was just a few adjustments. It is the properties that have increased in terms of appreciation in value. And then there was one tenant that was not paying my family rent, and they paid about 14 million, about sometimes in March. So
do you use your office to get them to pay?
My office of MP, of minister?
Yes.
No, I don't. No, I don't.
I
am not the one who corrects the rent.
Thank you, Alice.
Yes. Thank you. Thank you, Honorable Speaker.
We have checked your documents, and we find them to be correct, except you can tell us there were 9 memoranda against in response to you. Did you respond to them in writing? The clerk.
And I would ask that the committee adopts my response.
Thank you.
Yeah.
Unless you are lawfully held.
Yeah, thank you very much.
You are released to go.
I'm free to go.
Yeah.
Thank you. It's a relief, Honorable Speaker.
It's a relief?
It's a relief. I am jobless and I need the job. This is since 1985. This is one unique time when I am jobless. So, and I do appreciate the opportunity to be before the committee. Thank you very much.
Thank you, Alice.
Thank you.
Members, I give you a 20-minute lunch break. How much time? You have 2 others to go. Half an hour. Okay. Yes.
Maybe after chairman,
yes,
we could consider the suggestion I had floated in the group.
Let's go and discuss it at the lunch place.
Yeah.